Happened to my glasses there. Hello, hello, my friends. Let's see here. Do I have all my settings? Yep, I do. Hello, hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network, and it is time for another live IC support group meeting. Now, I'm walking wounded today. I hurt my SI joint 2 days ago, and so if you hear me gasp, that's it. You know, it's always something. It's always something. So anyway, my purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that it's all in your head, because it's not. And you know, I'm part of an international masterclass on pelvic pain, and we had a meeting a couple of days ago, and I'm doing a big presentation at 6:30 a.m. on Saturday. And it's really all about breaking the perception that a woman or a man with recurring chronic bladder or pelvic or prostate pain, that it's all in our head, because it's not in our head. And for many of us, it's actually injury or trauma. So anyway, it's our first year of 2024. This is the 30th year that the IC Network, our health education company, we facilitate the largest IC support group in the world. We have more than 30,000 members. And we work with patients throughout the world in more than 90 countries. And most importantly, it's free. You don't have to pay anybody to learn about IC. It's free on the IC Network website, which is icnetwork.org. And not only is it free, it's the best information you can get on the internet, because it's been rated in 2 medical studies as the most accurate and reliable website dedicated to IC. This was done by the Children's Hospital of Harvard. We were rated #1 on the web, and also by the University of London over in England. I also want to take a moment and thank our sponsor, Preleaf. So Preleaf is owned by a company called DSC Healthcare Solutions. It was originally owned by AK Pharma. And when we're thinking about over-the-counter options for patients with interstitial cystitis, the #1 supplement that has been used for decades is, in fact, Preleaf. Preleaf is an acid reducer. And so hopefully some of you used it over the holidays. If you were eating food that you knew could irritate your bladder, you can see right back on the website, on my shelf behind me, some boxes of Preleaf. Calcium glycerophosphate doesn't do anything for the bladder. Don't think that it's a bladder treatment. It's not. What it does do is it reduces the acid in food. So if you're just desperate for that cup of coffee, and if you're flaring, you're not supposed to have any coffee at all. You know better than that. If you're IC sensitive or you're bladder sensitive and you're flaring, we want to stay off of all the strong acids. But when you're starting to feel better, you want to really give it a shot again. You can hedge your bets by taking a couple of Preleaf to reduce some of the residual acid in that coffee or in that green tea. Ironically, a lot of people ask me, they go, well, what can I eat? And I was working with a patient on Friday who was really struggling. I mean, just constant symptoms, absolutely believed she had a recurring UTI, even though her cultures were negative. She was in her 70s. And granted, this can happen to teens who are on birth control, or patients in their 20s who are on birth control. Anyway, she had all the symptoms of a UTI, but negative culture. So the question is, why was her bladder hurting so bad? Why couldn't she sleep so well? And of course, the underlying cause for her was menopause, that her bladder couldn't defend itself because the loss of estrogen changes the character of the bladder wall, makes the bladder wall more vulnerable. But what was she doing every day that was triggering her bladder so badly? Green tea. Now, a lot of you think, okay, I should be drinking green tea. It's good. No, it's not good. Green tea, in addition to the caffeine, is extremely acidic. I will tell you, I had one of the worst flares of my life after drinking green tea. And so this woman, thinking that she was doing really good for herself, was drinking green tea every single day. And I have no doubt that it was the green tea that was causing this constant daily irritation. So it's a new year. We get to try new things, and sometimes it's an opportunity to clean things up. To ask yourself, is there room for improvement? Is what I'm doing good enough? Or would I actually like to get better? Would I like more quality of life than I have at this very moment? And if that's the case, I'm your girl because I want to help you find that better place. So, um, normally when I do these meetings, I usually do a little 30-minute intro and then we take your questions. I'm happy to take your questions right now. We are simulcasting right now on Facebook and YouTube. So when I'm looking straight ahead, I'm looking at Facebook. When I'm looking over here, I'm looking at my second computer and I'm looking at YouTube. Okay, so gotta be honest, holidays were really rough. They were really rough for me. I am so glad it's a new year. I am ready to let 2023 go. 2023 was the worst year of my life. Obviously, you know why. For those of you who watch, it's because I lost my parents. So, getting through the holidays stoically, cried a lot when everybody was gone. I cried a lot. It's time for me, and it's time for you to think about what do we want to do differently this year? What can we do that will put our body, our heart, our soul, our spirit in a better place for 2024? And I think part of this is about addressing some of the things that haven't been that helpful. So, right before New Year's, I posted on Facebook how to take charge of your icy symptoms in 2024. There's an old way and a new way. So here's the old way of icy. Number one, believing that you have an incurable bladder disease. You have to remember that up to 85, maybe even more, I personally think it's more, 85% of IC patients actually have hypertonic pelvic floor muscles, very, very tight pelvic floor muscles. The problem is you think it's your bladder because it's giving you bladder symptoms. Of course, you're thinking it's your bladder. You're up all night. You're not getting a good night's sleep. You're running to the bathroom every 30 minutes. The problem, though, is you're doing bladder treatments, but are you really getting better? Are you flaring? Because if you're flaring, you're not better. Why? We have to step away from this perception that you have an incurable bladder disease. Our guidelines from the American Urology Association flat out say that no disease process is found in the vast majority of IC patients, and the IC really is a neuromuscular disease or neuromuscular syndrome, not disease, neuromuscular syndrome. Now, are there patients who have a disease process happening? Absolutely. Hunner's lesions, definitely. Chronic UTI, absolutely. Those are disease conditions. But for those of us who have negative cultures, for those of us who have tight pelvic floor muscles, it is in fact more of an injury than it is a disease. What's the second thing that we don't want to do anymore? We do not want to chase your symptoms. How many of you have been on bladder treatments for 10, 15, 20, 30 years? Did they work? Or are you still struggling? Because if you are still struggling, maybe it's helping your symptoms a little bit, but is it actually healing you? Is it actually fixing the cause of your symptoms? And the answer, of course, is no. Sorry, my hair is kind of all over the place today. It's kind of driving me crazy. Okay. So rather than chasing your symptoms, we need to focus on trying to identify underlying causation. What's the underlying cause? And you heard it from me first. Back how many years ago? 6, 7 years ago? What have we been saying in these groups when Dr. Christopher Payne said, hey, we've got subtypes? What have I said? Every meeting in the last 6 years, we have to focus on underlying causation. When we find your underlying cause, we can treat it and hopefully resolve this problem so that you feel better. So in my case, I have a perfectly healthy bladder wall. And yet I did bladder treatments for decades, never worked. Then all the pelvic floor work came out. I had a pelvic floor assessment. What do you think it found? Terribly tight pelvic floor muscles. Finally started doing the right the right treatment for me, which was physical therapy. And my IC symptoms are gone. My IBS is gone. My vulvodynia is gone. The vast majority of my symptoms are completely gone once we recognize my underlying cause. Now, of course, I can hurt myself again. And I hurt myself frequently. I hurt myself 2 days ago. And when I do that, I know what to do, which means I have to start working on muscles. Okay. What's another old way that we want to address? Number one, please stop being afraid to eat. You do not need to be afraid to eat food when you have IC and or pelvic floor dysfunction. You have to respect the fact that your bladder is vulnerable, and it's your job to create an environment that will support healing. And how do we do that? We do that by reducing the very, very strong irritants, the strong acids, the strong alcohols, and caffeine. But there are so many foods that are IC friendly. And over on the IC Network website, icnetwork.org, you can download our 14-page diet list, which has 3 columns: bladder friendly, try it, and caution. And that's a really, really great place to start. But that said, some of us have very different sensitivities anyway. And so taking some time to maybe start doing a diary now, like maybe for the next 2 months. Why don't you write down what you're eating and then rate your pain on a scale of 1 to 10, or write down or record how many times you go to the bathroom. And let's see if we can find a little bit of cause and effect going on here. So an example of a common bladder irritant is a multivitamin. I had terrible flares with one-a-days and Centrums whenever I tried them. So if you're taking a vitamin every day, that could be one reason why you're flaring. At the IC Network, we do have a low acid vitamin called Bladder Smart. That's what I take now. And it works perfectly. But the old traditional vitamins, the cheap vitamins, they use ascorbic acid as their source for vitamin C. And that's very, very irritating to the bladder. I was working with a patient a couple of days ago who said she was down to eating like 4 foods: chicken, blueberries, rice, and Brussels sprouts. I was stunned. I was absolutely stunned that her diet was so limited. It's just not healthy. We've got to get some food in again. You're probably going to be able to eat 90% of the foods in the try it list. You just need to do them one at a time. Just be slow and thoughtful. Hello, C's from Scotland. I love Scotland. C's, I have a Amazon page for our customers in the United Kingdom. And if you go to the front page of our store, icnsales.com, go all the way down to the very, very bottom, look to the links, you're going to see something that says UK. And I have given you supplements in the United Kingdom that are very similar to the supplements that we have. Okay. And let me just say some highs here. Hello, Arcana. Nice to meet you. Hello, Helene. And Arcana, hold that thought here. I'm going to come back to that. And let me just go ahead and say hi to Anne, to Gay. Hello, Kayleen. Hey, girl. Hey, Deborah. Hello, Paula. Hello, Larissa. All right. Getting back to my thing. What's another old way to focus on IC? Believing you've got to pay anybody to learn about IC. You don't. You don't have to pay anybody to learn about IC diagnosis, IC treatment, to get support. Our website is free. The ICA's website is free. We have been doing this for decades. And I'm every now and then, things come up where people are charging a lot of money to teach you about IC. And I'm telling you right now, the best information you can get on IC is right on our website, and it's free. So please go there first. We also answer the phone, and that's free. If you would like to talk to me, that is free. I am happy to take phone calls. All right. Okay, so what's the new way? So what's our new way? Well, number one, we want to focus on IC as an injury to muscles and nerves for most of us. So we're going to start focusing on muscles and nerves. Another new way is we're going to try to find the underlying cause of your symptoms with phenotyping. No more wasting your money and time, 5 years, 10 years, 15 years, doing a treatment that's not effective. We want to start introducing back the things that you absolutely love, like your favorite foods and being able to enjoy intimacy. Now, it's interesting. So I posted that to patients, but then I don't know if you guys know this or not, but LinkedIn, so we work with the IC network has 3 goals. We work with patients, we work with IC researchers, and we work with physicians. Because if we don't educate our physicians, you guys aren't going to get the care that you need. And if we're not supporting researchers, we're not going to have the new therapies. And so one of the places that I interact with a lot of doctors is on LinkedIn. So when I make posts on my account over on LinkedIn, I'm always talking to doctors rather than to patients. And so, what's interesting is I rewrote the what's old and what's new, and I did it for doctors. And I want to go through this with you too. Some of it's similar, but there's a couple of very, very different points. And I'm actually working on a new presentation where I want to cover this a little bit more. So this is what I said to doctors, and you tell me if you think I nailed it or if I missed it, okay? The old way, believing that your patients have an incurable bladder disease, that no disease is found in the bladder wall of most, but not all patients, but the great majority of patients. The old way, chasing their symptoms with medications that don't treat the underlying cause. Ineffective and expensive, these patients may struggle with symptoms and flares for decades before the right treatment is found. Number 3, continuing bladder therapies such as Elmeron when cystoscopy finds healthy tissue and or patients are not responding to treatment. I mean, it's a real conundrum here. I mean, literally, you've just had a hydrodistension with cystoscopy. They've looked at your bladder wall. You have a perfectly healthy bladder wall, like me. So why are you doing bladder treatments? Why are you doing treatments that focus on a disease process when you have a perfectly normal, healthy bladder? We're really trying to get doctors to really start focusing on calming nerves and all that sort of stuff. And the old way, believe that it's all in their heads. It's astonishing that in 2023, some doctors are still saying this to their patients. It wasn't in my head. It began with a broken tailbone that triggered pelvic floor tension and nerve sensitization that eventually transitioned into widespread pain. And I gotta tell you, last night because I totally blew out my SI joint 2 days ago. I mean, it's ugly. It's probably the worst I've ever done. I'm going to be limping for a week now. And so I'm just kind of getting in there, right? Oh, see, like that just hurt. and just touching my tailbone, because again, my symptoms began after I broke my tailbone in 7th grade. And I realized that how often do I talk about tailbones being crooked? You know, your tailbone is supposed to be curved under. And I really hadn't touched it in a while. And my tailbone is straight and it has a big knob on the end of it because I broke the tip off. The tip is free floating about a half an inch away from the rest of my tailbone. And it's like going, God darn it, Jill, what do you always say to patients? Look at the tailbone. Can we fix that tailbone? Or at least helping us to understand why the muscles that are attached to the tailbone get all funky. I was rather dismayed to be reminded that that old injury is still haunting me 50 years later. Okay, so what's a new way? What's a new way that we want physicians to work with patients? Number one, find and treat the underlying cause using phenotyping. The AUA guidelines establish that there are at least 3 distinct patient groups: bladder wall, pelvic floor, widespread pain. Dr. Chris Payne proposed 5 distinct groups. And for those of you who have watched me for years, you know that that's a system I use. And Dr. Curtis Nickel actually suggested that there are 9 unique patient groups in the IC patient population. Okay, number 2, rather than disease, please help your patients understand that IC is often the result of injury, usually to muscles and nerves. Encourage physical therapy to address ischemia caused by tight pelvic floor muscles. More than 85% of IC patients have hypertonic pelvic floor muscles that respond very well to physical therapy. Understand the legacy. So, several times, but I'm thinking of one patient in particular that I talked with probably 2 months ago. Her pelvic floor was so tight. She had not had a pelvic floor examination in a pap smear in 25 years. Like literally, the doctor could not even insert his finger in her vagina, much less a speculum. And the last time they tried it, it hurt so badly. She said, "That's it. You're never doing it again." Her muscles were like concrete. And so here we are talking, she and I are talking, and we're kind of doing our subtyping, and pelvic floor comes up. She has pain. Well, she can't have sex. She's never been able to have sex. When she tries to urinate, she can't start her urine stream right away. There's like massive hesitation, a minute, 2 minutes, 3 minutes before she can relax enough to release urine. And I go, "Honey, do you realize that that means you have tight pelvic floor muscles?" She goes, "I know. I know I do. I haven't been to the doctor about it in 25 years. I'm just dealing with it." And I said, "Well, that's not good." And she's like, "Why?" And I said, "Do you understand the toll and the consequences of tight pelvic floor muscles? Do you know what that's doing to everything in your pelvis?" And she said, "No, I'm perfectly content to live this way. I know having sex hurts. I know that going to the doctor hurts. I'm just not doing it. I'm just going to stay here and just live my painful narrow life." And I said, "So think about it this way. If your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder?" And she's like, "I don't think so." When I went, "You're right. You won't. You're in ischemia. 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 What does ischemia mean? Ischemia means poor blood supply. It means that the tissues are struggling to live because they're not getting food and they're not getting nutrition. And so having tight pelvic floor muscles for a long period of time is actually quite devastating to every other structure in the pelvis. From your nerves, you know, the nerves need blood supply to work. If your nerves don't have blood supply, they cannot work and they become injured. They become more sensitive. And wouldn't it be nice to be able to sit down for a period of time without pain? Anyway, it took me a while. I just talked to her over and over. I was like, think about what that's done. Wouldn't you like to be able to do the things you've been avoiding all this time? And she finally said yes. And I said, well, now we need to start thinking about these muscles. Referred her to a physical therapist. And in cases like that, where muscles are super, super tight, the physical therapist is not going to be able to do internal work. They're always going to start externally. And she's probably going to have external work for months before muscles get relaxed enough so that they can start to work with some of these muscles internally. And I already had because I knew standing up and turning around would hurt. So I took my thing down. Okay. So hello pelvis, hello pelvic cavity. So right here at the front of your pelvis. Side to side, hip bones. We have our pubic bone right here, which is actually two bones that are attached together. Right? Look at it in the back way. We've got our vertebrae. We've got our sacrum. And we've got our tailbone. And let us look at everything that attaches to the tailbone. Do not assume that your tailbone is unimportant. We humans use our tailbone to balance too, just like dogs and cats do. It's smaller, but it's integral to the musculoskeletal health of your pelvis. All right, now let's look at it. Whoops. Let's look at it from the bottom. And what you're looking at here is the second layer of muscles. The first layer of muscles is right here, okay? So the reason why internal work is so incredibly important is because that's how you reach these muscles. You see that? That's how you reach these muscles. So for that patient who's got very, very severe pelvic floor tension, we want to make sure that we relax the muscles out here enough so that we can start calming them so that eventually they can do some internal work and get back up here by that tailbone that might be messed up, right? Okay. So what's our goal? To reverse ischemia. Reverse ischemia. All right. What's the next thing we want doctors to do? We want doctors to tell their patients that the patient's job is to create an environment to support healing. And we're going to do that in several different ways. We're going to try to relax muscles. We're going to try to calm nerves. We're going to try to reduce bladder trauma. When Hunner's lesions are present and aren't responding to treatment, test for viral infections, such as from polyoma or Epstein-Barr. Multiple studies continue to identify virus in the urine of patients with Hunner's, and antiviral therapies may be the future for some of these patients. And last summer, we had our first formal study that showed that antiviral therapy was effective for patients who they were able to identify a viral infection. So look to that in the future. And then the last one is probably the biggest one. In fact, we were talking about that a couple days ago. Widespread pain. So for those of us, myself included, who have multiple pain conditions, why? Why does that happen? So why did I have frequency urgency, and then I had vulvodynia, and then I had irritable bowel in my 20s, and then I got migraines, developed all these crazy sensitivities? Why does that happen? Research has now identified childhood injury or childhood trauma. So what the research shows is that for 80% of the children who develop chronic overlapping pain conditions as an adult, there is a major physical injury. I can still remember I working with a an older man who lived up in Lake Tahoe who had his pelvis crushed as a child when he was run over by a car. And he had struggled with bladder symptoms his entire life. We know that 14 days of pain will sensitize the central nervous system. And it is indeed the central nervous system that is driving all of these pain conditions. That this is essentially an injury or trauma to the central nervous system. And for the other 20%, it's a history of abuse or bullying. And many of you know my story. I've shared it many times that I grew up in a neighborhood with a young man who raped and murdered my neighbor. And I was one of his earliest victims. And I did not leave my house without fear from 4th grade through high school. That's why my condition progressed throughout my central nervous system. I was badly injured. But there's great, great news here. And that is we know how to calm those nerves down. So what the researchers found, so we have the Chronic Pain Research Alliance, which is an incredible research team. And their job, they were put together about 15 years ago. Their focus was to try to figure out why some, but not all patients have multiple pain conditions, because a lot of you have IBS and a lot of you have vulvodynia or prostatodynia. And a lot of you might have fibromyalgia. So this team was put together to figure out why did that happen to you and me, but not to other people? Because God darn it, I wanted to know. I wanted a normal life. I did not have a normal life because I had all these pain conditions when I was younger. So what this research team did is they studied the entire body and they focused on the pelvis and they started focusing on nerves because clearly patients with widespread pain have nerve sensitivity. Do you have super sensitive skin? Do you have a wicked sense of smell? Can you smell things that other people can't smell and the smells drive you crazy? That is a sign that you have a very sensitive nervous system. And the ultimate sign that you have a sensitive nervous system is, in fact, struggling with anxiety. And I had terrible anxiety in my 20s. I had panic attacks right and left. What this research team found was patients who have widespread pain have a brain that is absolutely stuck in fight or flight. The 24 hours a day, 7 days a week, that patient's brain believes their life is at stake. And that fight or flight response, controlled by the amygdala, is dominating everything. It raises your heart rate, it raises your blood pressure, it tightens your muscles. Normally, fight or flight is short term. If you were to open your front door and see a tiger across the street, of course you're going to go into fight or flight. Of course you will. The sympathetic nervous system will take charge of your brain. It has one job: to save your life. You have sensed a threat. The amygdala now has total control of your brain. It sends out adrenaline. What is it going to do? Raise your heart rate, raise your blood pressure, and tightens your muscle. It's preparing you to fight for your life or flee for your life. It's preparing that young girl walking to school to fight for her life because she kept being attacked. Okay, but it's 2024. We have a phone. What do we do now? We see a tiger, we shut the door, we call the authorities, they come out, they trank the tiger. The tiger's gone. An hour, 2 hours later, the threat is gone. The threat is completely resolved. And at that point in time, fight or flight is supposed to turn off. The parasympathetic nervous system retakes control of the brain. And what does it do? It lowers your heart rate, it lowers your blood pressure, it relaxes your muscles. But that's not happening in patients with widespread pain. You're stuck. We were or are stuck. I was stuck. And I was stuck from 4th grade until the age of 35 when I took my first anxiety management class. No shame, no blame. I didn't do anything wrong. You haven't done anything wrong. Something happened to you. One of the common themes that we see when I work with patients is growing up with an abusive alcoholic parent, where school is your safe place. Your scary place is living at home. As soon as you leave school and start to walk home, what happens? You go into fight or flight. The closer you get to home, the worse it gets. And now you're at home and you're dreading the sound of the car because that parent's coming home from work going, oh my God, it's going to happen. And then they come in, put their stuff down, pull out a beer, pour a glass of wine, have some whiskey. And that young child's brain knows that bad things could happen. And fight or flight takes over. So what happens basically is our brain gets stuck in fight or flight. But we know exactly how to turn it off. And we can turn it off now. I have turned it off for me. And that's one reason why all of my symptoms are so much better. And I haven't had a panic attack in 30 years, more than 30 years. No, 28 years since I took my class. And that's one of the things that I want to teach you for those of you who have widespread pain is how to calm that central nervous system down. No shame, no blame. It's not all in your head. You're not mentally ill. You have an injured central nervous system. Because anxiety intensifies pain, patients must learn new anxiety management tips, but not with any suggestion that they have caused their symptoms. Again, this is injury. We must bring the brain out of chronic fight or flight to calm the entire central nervous system down so that we can calm the nerves down in the bladder, in the bowel, in the skin, in the vulva, etc., etc. So anyway, obviously, as you know, I have fairly strong opinions about this, but I'm also extremely educated and I study IC almost every day. Those are the things that we want to see in 2024. And if you're not getting better, if you're struggling, then we want to take a step back and revisit the diagnosis and maybe do a proper phenotyping to make sure we know that you know what you're treating. And I want you to promise me something. You will never, ever, 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 ever let anybody put anything in your bladder without telling you what it is. That just happened. That happened to another patient last week. She just didn't want to be involved. It's just like, here I am, fix it. And she let the doctor give her bladder treatments, and she had no idea what the treatments were. None. And when I asked her, what did they put in there? She goes, I don't know. I'm like, how can you possibly not know what your treatment is? And she's like, I don't care. I just want it to go away. Well, we can't have that attitude this year. We have to be educated, informed, and involved, and being an equal partner in your medical care. Your doctor is not the boss. You're the boss. You pay them. They don't pay you. Okay. So anyway, and she still doesn't know what she had. And I have no clue what she had. She's like, why didn't it work? And I went, I don't know why, because you don't know what it was. But if it was an old bladder treatment, like chlorpactin or silver nitrate, yeah, well, we don't do that anymore. You got to be involved. You got to know what your options are. And again, you can find this information on the IC Network website, icnetwork.org. Let me move this. Move that over right away. All right. So anyway, oh, darn it. Oh, ow. This SI joint is so unhappy with me right now. And I'm wearing my SI belt too, and it's barely helping. Okay, so it's time for questions. Let me see if I can go through some of the questions that we have so far. I'm going to start on YouTube. Arcana says, this is my first live stream. I've had IC since 2006. You just had your Medtronic Interstem and Bulkamid in 23. I have pelvic floor dysfunction and physical therapy. I was in the workforce for 20 years, the last 15 years as a recruiter, terminated from on-site jobs due to number 2, frequency and urgency. Symptoms got so bad in 23 that I filed for disability, had several surgeries the same year, Still not well, still not optimistic about the future. Any advice? And then she says, "This is great information I got." I say, "Okay, guys, what's my favorite question?" The favorite question, the most revealing question that I ask patients when I work with them, is there any event that you associate with the onset of your symptoms? Arcana. I got icy after a major car accident in 2006. The seatbelt was in the bladder area. The whole area was bruised. Okay, so Arcana, number one, don't know how old you are. Age matters. So if you can share how old you are right now, that's great. I would really appreciate that. Um, um, for patients whose symptoms begin in their teens or 20s, or even early 30s, we really always want to look at trauma first, like a car accident, or maybe having a child and the delivery was very damaging, maybe some nerves. In fact, I was working with another patient whose third baby, third C-section really damaged some nerves, which was quite interesting. So I guess Arcana, I would want to know, number one, are your muscles responding to physical therapy or are they always staying tight? And that's the single most important question to ask that physical therapist as you're working with that physical therapist over time. Because if your muscles are always locking back down into tension, no matter what they do, a week later, a month later, you're back to where you always are, which is like me on my left side. Why? That's when we have to look at bones. Was your tailbone injured? Was your hip injured? Has your SI joint become unstable like my SI joint? And if that's the case, we got to start working on that. One of the other things we consistently see in patients whose muscles always stay tight is how they walk. They're not walking normally. We have an ankle that's rolling in or an ankle that's rolling out, or they're duck-footed or pigeon-toed. How that foot meets the ground, the stresses of that will go directly up through the legs into the pelvis and cause tension in the pelvis. And let me show you a picture here. Let's see here. And also, too, I'm just going to flat out say it. Listen, if you're riding horses, if you rode motorbike, you did dirt biking for a long period of time, that's when we're really going to look at muscles. You see this picture of a bicycle seat pushing directly into muscles and nerves here. It's really quite interesting. Okay, so let's look at this picture for a moment. This is the perfect example of what happens if you're not walking normally. So this is the healthy leg. So you're going to see that the shin bone, 90-degree angle from the ground. And as we follow that straight line up, yes, the femur does go out because it has to attach to the hip bone, but you can see that the leg is essentially straight. And if we look up really close, you can see the hip bone and the top of the femur, the hip bone. And here we have a nice, plump, healthy, very healthy piriformis muscle. Now let's look at this picture. This is a picture of somebody whose ankle rolls in. So immediately we start to see displacement. So that shin bone, instead of being straight up, is now at an angle. And it's like maybe a 20-degree angle. It's not straight anymore. And that angle is going to be exaggerated in the femur, and the femur is now pushing straight out. And look, do you see what that's doing to the piriformis muscle? That it's stretching the piriformis muscle. It's keeping that muscle tight. Here's a healthy fat piriformis muscle. Here's a long, skinny, stretched piriformis muscle. So that's an important question, Arcana, is I want to know what's going on with your muscles, because it's likely that I'm trying to visualize what a seatbelt injury would do to the I mean, obviously, if it's a very depending upon the violence of the crash, the impact of the crash, could you have bladder damage, bladder rupture? Sure, you could, but it doesn't sound like that happened. So the second thing that we're gonna look at is how did that hurt the muscles and the nerves? And it's far more likely that we have muscle and nerve injury that's underneath it all. Another question for you, Arcana, is do you have pain when you sit down that gets better when you stand up? Pain with body position. Helene says, can lower back pain create the need to urinate frequency? I have bulging discs and injured my back recently and have been feeling extreme urgency frequency for the past few days. Yes, it can, honey. Yes, it can. You know, ruptured discs and bulging discs. The hard part about rupturing discs, because I have ruptured discs at L4, L5, and as my doctor said to me, and I got mine during a fire evacuation. My dad wouldn't leave without his 70-pound gun case, and I had to drag his gun case up a flight of stairs, and I ruptured discs in my back. And as my doctor said, it'll heal, but it'll never be as strong as it was. It will never be as strong as it was. So you're gonna hurt it more frequently, and that really sucks. Okay, Arcana says here it was a Penske truck. I was a passenger. The truck flipped 4 times and landed on my side. Wow. What other injuries did you have, Arcana? I'd love to hear what other injuries you had. Any like a broken leg? Anything at all like that? Broken pelvis? Broken hip? Let us know. Okay, let's come over here to Facebook. Okay, Anne says, if you have discomfort high in the anus with no pain, I feel it when I sit. What is it? That's a pudendal neuralgia, honey. More than likely, that's a pudendal neuralgia. Also, can I get a microgen test done right in the doctor's office? No, you can't. I mean, they can take the swab or the sample, but you have to send that off to the company to do. Paula says, I was just diagnosed with lichen sclerosis to complicate my symptoms. So, Paula, I'm very, very familiar with lichen sclerosis because my mother had lichen sclerosis for many, many years. And I was literally the one who took her to the gynecologist. I was the one standing, and when she was in stirrups, we were both looking at her, you know? And the thing about lichen sclerosis, the name is a little misleading because of the word lichen implies some sort of biologic like a mold, but it's not. Lichen sclerosis actually is very, 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 very poor blood supply, and the skin basically turns white. And we didn't really understand that at first. I mean, the nerves become very, very inflamed, very, very irritated. The treatment for lichen sclerosis is clobetasol, which is a very strong steroid. But when I think about my mother, the one thing that comes to mind, especially as I saw her get older, is that her muscles were toast. Now, why do I say that? Because she had just, you know, Mom, I love you, Mom, but you're a good case study. So, and she's like, I know, Jill, you can say whatever you need to say. Okay. So, um, in the last couple of years of her life, she would have her bowel movements after dinner, which I thought was very weird. Most of us is after breakfast, but for her, it was all after dinner. And she would be in the bathroom for an hour. And I'm like, why is she in the bathroom for so long? And then I finally, obviously, she was very elderly. And because I had to make sure she hadn't fallen, I peeked in and I would catch her doing this on the toilet. She would lean up. Oh, ow, ow. Sorry. That's my SI joint. Anyway, she would lean all the way back and she'd grit her teeth and she'd be straining really, really hard to have a bowel movement. And she hid that from me for years because I gave her the dignity of not being involved with that. And then I finally caught her doing that. And I just like, oh my God, what are you doing? Stop. She's like, this is what I have to do. And I'm like, no, this is so bad. This is so damaging. And we tried to up her fiber and all that other stuff to try to make it better. But in the end, that's one of the things that I know that she doesn't miss and I don't miss was dealing with all that pain that she had, the struggle she had with very, very weak pelvic floor muscles. So, Paula, in hindsight, I really think that her lichen sclerosis was caused just by very, very dysfunctional muscles. Again, if the skin is white, that means there's no blood supply. That's classic ischemia. And so I would want to know what's going on with your pelvic floor. That's my educated guess. Thank you, Gay. All right, getting to seeds in Scotland. Um, Here, hold on a sec. Okay, so PEA, again, go to the IC Network store. On the front page, very, very bottom, there's a little black link that says UK customers. I'm going to fix that and make that much bigger, but that's where you can get PEA from other manufacturers over there. Uh, Larissa says, I too have lichen, seeing 2 specialists. Excellent. Ahiman says, I was diagnosed with high blood pressure when I was 16. I started taking nifedipine as a maintenance med, and when I was 18, still even with the medicine, I had symptoms of hypertension. So I tried to lower my sodium in a slow process. I had the whole world. Here, hold on a sec. Oh, honey, I'm sorry. You guys, this is an advertisement. Ugh. Amen. I don't know if you're still in here or not, but so inappropriate. Please do not use our support group meeting to make posts like this. So you are done. You know, when I started the IC Network 30 years ago, and we had our support forum, which we still have, not used very often now, but back in the day, it was used by 200,000 patients a month. We always caught salespeople pretending to be patients to sell stuff. It used to piss me off like nobody's business. All right, here, hold on. Larissa's asking about the clobetasol. The clobetasol was really good. Also, soaking in a bathtub with maybe some Aveeno, with a little bit of baking soda in a warm bathtub can be very, very soothing for hemorrhoids, for vulvodynia, etc. Gail said, I started physical therapy again this week for tense pelvic floor muscles. Good job. She put me on bladder retraining plan along with relaxation breathing. I'm on day 3 of retraining. I need encouragement that this will get easier because it's painful and you're getting to the time interval is really, really difficult. So bladder training, the purpose of bladder training, which is basically timed voiding, is to slowly and consistently expand bladder capacity. So if you were peeing every 15 minutes, what they're going to say is, okay, see if you can hold it for 20 minutes and try to time it out every 20 minutes, and then try to time it out every 30 minutes, and then try to time it out every 45 minutes. The challenge here is the pain component. I interviewed the guy, Paul Kraprowski, who actually invented that technique. And actually, he came and appeared at a IC event that we did. And he said, you don't normally do that if you're in pain, because what we don't want to do is activate all the nerves. Because if you're holding your urine to the point that you're crying in pain, we're defeating the purpose because you're basically amping up your nervous system. So kind of the protocol was try to figure out what's causing the pain first, try to get the pain under control. When we got the pain under control, then start doing the time voiding. Katie said, can you review the best products for constipation with IC, Hunner's lesions? Miralax, Heather's tummy fiber, and most of the common products that bother my IC. So with constipation, you have to remember that the gut works in a food in, poop out approach. So normally you have your first bowel movement in the morning after you've eaten breakfast. Some people make the mistake of trying to have a big bowel movement before breakfast. And if you don't have the natural urge, and we all like it, everybody likes it. If you can just get it done first thing in the morning, you don't have to worry about it all day, right? But if that natural urge doesn't come for one reason or another, the last thing you want to do is sit on the toilet and strain like my mother used to do. The gastric colic reflex is a food in, poop out. And so the way I try to get, if I'm starting to feel a little stuffed up, like I could go, I would really like to go, I eat a big breakfast. I make French toast with Ezekiel bread. I drink a big cup of something hot, usually Dandy Blend herbal coffee, and then I eat an apple. And there's just something about that combination, usually within 15 to 30 minutes later, things are moving along and I'm feeling better. So concept number one is you pick your time. I mean, you cannot pick your time. You have to listen to your body and understand that it's the eating of a meal that generally triggers a normal response to have a bowel movement. The second thing we want to focus on is fiber intake. If you're pooping rocks, painful rocks, as I have been known to do every now and then, that means you're not eating enough fiber and drinking enough water. So to have healthy bowel movements for women, you need 20 to 25 grams of fiber a day. For men, 25 to 30 grams of fiber a day. And so we got to start upping that fiber. But the type of fiber is important because if you have sensitive nerves like I do, doing things like granola, yeah, you're going to have a nice poop, but it's going to hurt. We do better with soluble fibers. And it was Heather Von Voores, the author of First Year IBS, who runs a fabulous website, helpforisbs.com, which taught me that along with my IBS doctor at the time. And so we do better with fibers that are soluble. They dissolve in water, not insoluble. And so that instead is going to be things like green peas. Listen, 1 cup of green peas, 13 to 16 grams of fiber. If you're eating lettuce and lettuce salads because you think that's high in fiber, you're wrong. A cup of lettuce is 1 gram of fiber. It's not going to help your constipation, but eating peas or beans will in that solute. So, for example, I like pinto beans. So I've been buying a low salt pinto bean. When I feel like I want to have beans. For some reason, kidney beans, a lot of gas. I don't really like kidney beans anymore. I like the white navy beans and I like pinto beans. So I'm going to have at least 4 or 5 times a week a serving of green peas or a serving of pinto beans or garbanzo beans. So, and then in terms of products, Heather's Tummy Fiber is a fabulous product because it is soluble fiber. If I'm ever feeling like, I still didn't quite get enough or my diet was terrible that day, I will take a teaspoon or maybe a heaping teaspoon of Heather's Tummy Fiber. I'll put it in a shot glass and put some water in it, and I'll just down it before I go to bed. So that's what I do. Going with Miralax is fine if that's, what works for you. You want to stay away from stimulants. So doing the, what is that tea that's a stimulant? Got to be careful with the stimulants because if you're using a stimulant to have a bowel movement every day, you're messing up your nerves and now your nerves are going to want the stimulant. So we want to stay with really simple, fresh, healthy, natural fibers. Here, hold on. Let me get a drink here. All right, hold on a sec. For anybody, C's was asking a question about stars. If you find these meetings helpful, the best way that you can keep me doing these meetings is by coming on over to our website, signing up for our free newsletter, And then checking out our store. We have a great book called IC 101. It's not just a bladder disease. We have pre-leaf, we have all the supplements, we've got heating pads, chair cushions, you name it, we've got it over in the ICN store, and I curate all of those. That's the best way that you can support us. And you'll notice, for those of you who get email, I don't send out fundraising letters. I actually, when I mean, I have been a nonprofit fund development director, and I know that that's a very important strategy that nonprofits use. I always found them very, very offensive, and I really hated those letters that talked about patients who were suicidal. Like, you can save a life if you do this. Like, baloney! You're doing that as a marketing pitch. I want you to decide if you want to support the IC network based upon if I can help you. If we can't help you, I will try to turn you on to somebody who could. All right, let's see here. Angie said, I was recently diagnosed with pelvic floor dysfunction, but my whole body hurts. Yeah, well, honey, because your pelvic floor is in the center of your body. And so, you know, so for example, you've got muscles, the psoas muscle that goes down your spinal cord on both sides is a big ropey muscle, and it ends up being anchored down in your pelvis. And so it's very common for patients for pelvic floor dysfunction to have tight pelvic floor muscles. And for me, my tension is all on my left side because of my left SI. So it's my left psoas muscle that will occasionally knock me out. And I will wear 3 body heating pads on a shirt up the left side of my spine to get this tight psoas muscle to calm down. And also, again, if your pelvic floor muscles are messed up here, then they're going to mess up your feet and vice versa. Your feet or your legs are messed up, that's going to affect your pelvic floor. So I'm not at all surprised that you've got body-wide pain. What is the treatment? Anne says, what's the treatment for pudendal neuralgia? It is to find the location where the muscle is, where the nerve is compromised. And how is it being compromised? It's usually being compromised by a tight muscle. And so the treatment is twofold. Number one, we want to calm the nerve down. They can do that with nerve blocks. They can do that with some oral medication like gabapentin. Uh, if you're having pins and needles, areas of numbness, they're going to use a lidocaine cream on the skin to just try to calm the most superficial nerves down too. It's all about calming nerves down, maybe using something like Peora, PEA. That would also help to calm some of those nerves down. And then we got to fix the muscles that are tight, that are pressing on the nerve, right? Denise says, Jill, I can't thank you enough for your advice on the Women's International Pharmacy on a regular estradiol with nothing. Let's see. You've been on a compound for over a month and you're symptom free. Yeah, baby. Woo! Love it. Marlia gives the name of the tea. That is a Senecot tea. And you know what? I'm having a bad hair day. I just got to get rid of this hair. It's like the my house is really, really dry and I get static electricity everywhere. Okay. This is how I wear my hair anyway, almost every day. It's in a ponytail. All right, let's go back to YouTube here. So Arcana said she was in a Penske truck, flipped 4 times, landed on her side. She had pain with body position, nothing broken, just bruised. Thanks for all the info. I'm going to ask about bones. Lori said, hi, Jill, your thoughts on Urabel instead of Peridium? Recently prescribed Urabel to use for post-intercourse, low bladder urethra discomfort, despite use of estrogen cream and V-Magic. Well, isn't that an interesting question? The question is, what is it about sex that's giving you pain? So normally, pain with intimacy. So for a man who has quote unquote IC, chronic prostatitis, chronic pelvic pain, their worst pain is the moment that they ejaculate, because that's when their strongest muscle spasm happens and it squeezes the nerves. And so for men, that it will feel, sometimes they describe it as like somebody shoving a knife up their penis, and it's really awful. And then once that muscle spasm calms down, then it kind of goes away. Well, it does go away. Whereas for a woman, the pain, that sex-induced flare, occurs 4 to 6 to 8 hours after intimacy, because that's when our muscles begin about 24 to 36 hours of gentle spasming, which I think is all about helping sperm meet egg. So it's very, very common for a woman to flare after sex, and that flare is going to last a day or two. So, Lori, the Urabel is going to calm the bladder down, and it's going to have some beneficial effects for the bladder, but it's not going to do anything for the muscle. At least I don't. I'm trying to remember method of action. I don't think it does. I would be very, very tempted instead to maybe try a muscle relaxant, like a vaginal Valium suppository. Vaginal Valium suppositories are like the perfect post-sex muscle relaxant that can nip that flare in the bud. If we can get that muscle to relax, things calm down. So that's interesting. Think muscle. Think muscle. Hello, Boria. Mary says, hi, stopped using Elmeron. How can I protect my bladder? Would like to talk to you about my problems down there. When is a good time to call? This week is, let me look at my schedule this week. Okay, that's canceled. I'm pretty open this week. Not available tomorrow, but Tuesday, Wednesday, Thursday, Friday. So I start answering our patient support line usually around 10:30 or 11, and then I answer it all day. So if you call our 800 number, you click on the patient education extension. It's first come, first serve. And so usually by noon, I'll have about 5 calls to return. And I'm known for returning phone calls late because I'm in California. So 3 o'clock my time is 6 o'clock your time. 5 o'clock is 8 o'clock if you're on the East Coast. So just know that I tend to work late. So if you call and I don't answer the phone, that just means I'm already working with somebody. Okay. And so just leave your name and number and just know that I will call you back when I can. And guys, listen, the squeaky wheel gets the grease. Don't email me out through Facebook. Don't use Facebook or messaging or Twitter messaging, anything like that. If you want to try to get a hold of me, email me directly, icnetwork@mac.com. icnetwork@mac.com. And speaking of that, I happen to have several cases of chamomile herbal tea that expire at the end of this month, and I'm just giving it away for free. I will cover the postage and send it to you. So for anybody who wants some chamomile herbal tea, of course, chamomile herbal tea is the best thing you can drink when you're having a flare. It has a mild, smooth muscle, anti-spasmodic property, and it's very soothing to the bladder. And so if there's anybody out there who would like a free box of chamomile herbal tea, I need you to email me your mailing address. No, don't just say I want one. You got to put your physical mailing address in there, and I will be shipping these out this week. So I already have, because I put it on Facebook a couple days ago. I think I already have about 12 people that ask, and I have I have more because we just ordered way too much last year. I just ordered way too much. It was ridiculous. So if you want a free box of chamomile herbal tea, I also have some other herbal teas. So some of you are going to get 2 boxes. It's just our giving it away at the end of the year. ICNetwork at mac.com. So Mary, just give me a phone call, okay? Just call 800-928-7496. Be happy to talk to you. Lori says, thank you. My urologist won't order vaginal Valium, but I plan to ask my gynecologist next month. Good. That's reasonable. And that's a compounded formula. I mean, they can do compounded suppositories, they can do compounded creams. One of the creams that is often suggested for patients who have vulvodynia or anything down there is an Omibach cream, which is a combination of amitriptyline and baclofen. So the amitriptyline to calm the nerves down on the skin, the baclofen to relax muscles. Others can add ketamine to it, a little bit of ketamine in there, or using a lidocaine cream, especially if you have a lot of burning on your skin down there and your skin is just on fire. How do we calm those nerves down with a lidocaine jelly or a lidocaine cream, which is available over the counter, but most gynecologists or urologists would prescribe that for you. And again, if you feel, so one of the other really important questions is, when is your pain the worst? Before you pee or after you're done peeing? So quite a few patients have pain not as their bladder fills with urine. Their pain occurs after they're done peeing. And it's especially manifested as a burning sensation that literally your vulva is on fire. Your urethra is on fire, your vulva is on fire. We call that urine burn, where your urine feels hot. Your urine feels like it's actually physically burning you, but it's not. What that means is that you are in estrogen atrophy and your skin is not happy. Your skin is getting dry, and we need to get that skin moist again. And the way we get that skin moist is with topical estrogen. When you give that skin estrogen, it immediately gets moist again. It starts to produce mucus, but it takes a little bit of time. One of the things you can also do is you can also, before you urinate, just put coconut oil or V-Magic on your vulva. That will be an extra coating that will keep urine off of those more fragile cells on your skin. So think about that too. Okay, let's see. Carolyn said, I was not I was not happy. Oh, ow, ow, ow. I was not happy with my pelvic floor therapist I had last year. She told me I have a weak vaginal wall. She didn't help. I still have my issues. Should I try a different therapist? Absolutely. Absolutely. You know, physical therapists are kind of like counselors. The first person you meet might be a match, it might not be. You've got to find somebody that you feel comfortable with. And a sure sign that a physical therapist hasn't been trained properly is if they tell you to do Kegels, or they're unwilling to do an internal exam or internal therapy. The single most effective way to treat this is, in fact, with a finger inside your vagina massaging these muscles. Right? You know, what happens is when these muscles get tight, they lift. They lift off of the bone. They start interfering with other things. And so basically, that physical therapist, this is exactly what they're going to do. They're going to go the length of the muscle, but sometimes they do strumming where you go crossways like this. And we're just trying to get this muscle to relax and release. If they find any trigger points, they're going to try to massage those trigger points. And each side, they do differently, right? I mean, so you're either going to work on the left side first or the right side first. One of the, and you know, just so you know, we want you to have independence here. If you flare, like if I have a muscle flare, I don't have to call the physical therapist and wait a month to get in. I know exactly what to do. And that is, I now have a wand that I use, and I will put my wand in here, and I'm just looking for the painful area. Healthy muscles feel like a raw chicken breast. They're soft, but there's substance to it. Tight muscles feel like painful beef jerky. And so when I put my, let me just get a wand here. Hold on. Okay, you're gonna see me go very slow here. Standing up is not fun. Oh, ow, ow, ow. Okay. Oh, okay. Got it. Okay. This is an SI belt. You see what that is? Okay. Oh, I almost decided I was gonna. There was a part of me thinking, maybe I should just not do it today, but no. First meeting of the year. If you can handle my pain, all right. Oh, hold on. That's a brand new one. We don't need to use a brand new one. Let's see. Here we go. So this one is called Icy Relief. You can get it from Desert Harvest, desertharvest.com. So here you go. The curve, well, number one, it's made of Pyrex, super easy to clean. I mean, this is the one I use. Super, super, super easy to clean. I really like this one. And the curve gives you kind of an extra ability to manipulate it. Mary says, "Are you okay?" Honey, I hurt my SI joint 2 days ago. It's my thing. It's my thing. It's my weak spot. Okay. It's just my left SI joint. Okay. Here you go. So you can see now I've got a wand in my vagina, technically, and I'm just going to use the wand here to reach these, because you can't do it unless you've got ginormous fingers, twice the normal length. You cannot do this with your finger. That to get to these deeper muscles, you really do have to use a wand. Learning to use a wand is weird because the first few times you use it, and what I do is I lay on my back and I put my feet up on the wall in my bedroom. Okay, and then I just stick it in. Not far, I'm really only this far. I mean, you're only going maybe 2 inches in there, really. And I remember the first, I didn't know what I was doing. I was just laying there going, what am I supposed to do? I have no clue. And my physical therapist was just like, Jill, just give it a try. And I'm like, okay, I tried, but I don't know how to. I have no idea what to do. Help me, help me. How do I move this wand to make this better? And she said, move it in a J shape. Just move it like a J. And I'm like, so I come back home the next day, put it in there. A J? No, a J makes no sense. I just literally, the first 3 months, I had no clue what I was doing. And it wasn't until I read this book, Breaking Through Chronic Pelvic Pain, which is the best ever book ever, ever, ever. It's better than my book, and my book's pretty darn good. But this is a fabulous book for anybody with pelvic injury. And you can get this from the IC Network shop. It's Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. So I can show you what the J is. So think of your tailbone as the center of your pelvis. Okay. And we've got muscles that go this way and muscles that go this way. This is the J that you slide around and up, and you slide around and up. So when I do my pelvic floor work, so again, here's the tailbone, I'm going around and up, around and up. So that's the J shape. And it's really helpful. Like, ideally, when you go to a physical therapist and you're laying there on your back and they're touching your muscles, I want you to know the name of the muscle and I want you to know where it is before you even go. You've got to learn about this because your ability to describe your symptoms gives them a roadmap. And how are you going to describe it if you don't know what the muscles are called, right? Or whatever. So anyway, um, there you go. The J shape. You can do strumming. You're going to push on muscles, and there you go. And all I can tell you from my perspective um, is that anytime I flare, like I had, okay, are you sitting down? Because you know what do I say? I'm symptom free. The vast majority, 99% of the time, or 98% of the time, I'm symptom free. I had a flare over Christmas with diet sensitivity. Now, y'all remember I had COVID in May at the hospital as my parents were dying. We all got COVID. I was coughing so violently. I need hot lemonade. I'm driving home from the hospital, get some lemonade, come home. I make my medicine balm herbal tea, hot lemonade with honey. No flare. No flare. I hadn't had lemonade in 30 years. I was shocked. I was expecting this terrible flare. I have been drinking lemonade for 8 months. In fact, there's lemonade in this right now. Okay? And that told me that my bladder wall had healed. With that physical therapy, I finally achieved total healing of my bladder wall. But over the holidays, I got to tell you, I was so upset and I was bawling my eyes out on Christmas Eve and Christmas Day. I mean, I'm sorry. I just, the grief when you lose somebody is terrible. And all of a sudden, that little bit of lemonade hurt. It's like, okay, Jill, look at that. You're finally sensitive to lemonade again. But I went and got my wand and I looked at how I was urinating. I wasn't urinating easily. I was stopping and starting. I did not have a good healthy flow. Therefore, I knew my muscles were tight. You can always tell the health of your muscles by how you urinate. If you're not urinating like a horse, your muscles are tight. You remember urination envy. You go into a public bathroom and the person next to you is peeing like a horse and you're stopping and starting. That's a sign that your muscles are tight. So that was happening to me. And then I had diet sensitivity. So what I do? I did this. How many times? Like twice. Diet sensitivity went away, pain went away, started peeing normally. That was fascinating to me. That was the first time I'd been sensitive to food. God, how long? Years. I hadn't had a diet-induced flare in years. But the origin of the diet-induced flare was massive muscle tension from me grieving and crying and just stress. So now I know when I have a diet-induced flare, again, I'm always going to suspect my pelvic floor. I have a healthy bladder. There's nothing physically wrong with my bladder, except a little estrogen atrophy now. Kayleen said, I know you've covered it, but can you talk about PGAD? Yes, I can talk about PGAD, persistent genital arousal disorder. So PGAD occurs when muscles are so tight, they squeeze the pudendal nerve. And the pudendal nerve is, in fact, the nerve that innervates your clitoris. And so when this nerve becomes inflamed, the clitoris becomes inflamed, and you end up with this painful arousal sensation. And it's so confusing because you feel aroused, which is supposed to feel good, but it hurts. I call this one of the dirty secrets of IC. It's definitely one of the dirty secrets of IC because you don't want to tell anybody about it because you don't want anybody to think you're getting some sort of sexual pleasure from having pain. Well, I had PGAD for about 3 months, went back when my symptoms were really bad. And then as all my nerves calmed down, the PGAD went away. Also had some allodynia. Allodynia means proximal nerves from the original irritated nerve become very, very sensitive. And so I went through a period of time where you couldn't touch me below the waist without even the slightest touch on my belly would have caused pain for me. Allodynia is when proximal nerves also become inflamed. And again, as those nerves calm down, the allodynia goes away and the PGAD should go away. One of the things that they do to confirm that is a pudendal nerve block. And if the pudendal nerve block makes the symptoms go away, then we know for sure that it's pudendal neuralgia. Paula says, I have a pudendal nerve stimulator, but it's not working. So you have to make sure you tell your doctor that it's not working, because if it's not working, you want to get that out. That's part of neuromodulation. Neuromodulation, also known as interstim, there are a couple of other names now. The theory behind neuromodulation is if we gently stimulate the nerves, we can get them to start behaving normally. The challenge is that it requires surgery. It requires the implantation of surgical leads. Originally, the leads were placed on the sacral nerve. That's why it was called sacral neuromodulation. But about 10, 12 years ago, they also started doing it on the pudendal nerve. The challenge here for both of those is that if they fail, if the device stops working, you want to make sure you get it out, because having leads in there and having a metallic or just a foreign body implanted where the generator is, which is usually in your upper buttock area, is problematic. The longer it's in there, the more scar tissue builds up around it, and it just gets harder and harder to remove. What kind of doctor treats pudendal neuralgia? OBGYN. Carolyn said, what's the name of the pharmacy? The Women's International Pharmacy, women'sinternational.com. Paula said, yes, they are removing it. Good. Kayleen said, how is a nerve block done? I've had 2 nerve blocks myself. No, I've had 4 actually. Have I? With a very long needle, and it's the doctor has to determine the location. So I can't tell you exactly where they're going to do it. My pudendal neuralgia is, let's see. How can I explain this to you? Here, hold on. Let me draw a pic. Let's see if I can draw a picture. Oh. Let me see if I can draw a picture. Okay. Is that a good picture? Well, kind of, sort of. So let's see. Oh, this might be better. So your pudendal nerve, okay. So you see these 4 holes in your sacrum? So the nerves come out of your spinal cord, and then they split off and go through these holes, okay? So the nerves kind of go from back to front. So then the nerves emerge here. And there's 4, right? There's 4. Then they come together and make 1. and they go through something called the Alcock's Canal. And then when they leave the Alcock's Canal, they split up again and they go to the front side and the back side of your pelvis. They go to the clitoris, they go back by the rectum, etc. There's a very wide range that the pudendal nerve serves. Well, the way they explained mine, because my pudendal neuralgia occurs when I sit down, and I get pain. Let's see, like right here. It's like right here. So it's about an inch to the left of the tailbone. And there's a little tiny fragment of nerve that curls backwards. So instead of going down and into the pelvis, there's a little one that somehow comes outwards. And what my gynecologist said for me is that it was that nerve. There's just a nerve somewhere in this area that kind of curves backwards. That is where my muscles compress that nerve and give me nerve pain. Paula said, I have nerve pain only when I'm laying down. I had a lot of nerve pain laying flat on my back in the day. But now that my muscles are much, much healthier than they were, I don't have that pain so much anymore. The only time, every now and then in the middle of the night, I'll get a flickering. The muscle will just start going, and it kind of wakes me up. And I think that I'm having a rapid heart rate, and it's like, no, it's not my heart at all. It's this darn muscle nerve flickering because of something about my body position at that moment. So Paula, you're having Dr. Peters remove your pudendal nerve entrapment? Excellent. I personally think he's, in all likelihood, the best surgeon for neuromodulation in the world. The reason why I say that is because you look at his published data on the results that he's had. He's known for being very, very meticulous. Other doctors are very quick and they just get in there and do it, and they want to be in and out very, very quickly. But you can't be that. You can't be that way when you're working with nerves. It's a very slow, thoughtful, experienced hand that can reach down to the proper location and find the nerve, because nerves are also squiggly. We're not always the same, so it's not always where you think it's going to be. So somebody like Dr. Peters is really going to be the best case scenario for removing it and putting it in. I'm not against neuromodulation. You just have to be really informed about it. Okay, let me come back to YouTube. Thank you, you guys. Thank you, YouTube. Cindy said, thank you for turning me on to Dr. Peters. He recommended guided pudendal nerve blocks. Yeah. Also, Hunner's removed later, sitting and peeing on my own for the first time in years. You're my idol. Cindy, oh my God, girl, you just totally made my day. I love it. Look at that. You're sitting and peeing on your own now for the first time in years. Oh my goodness. I'm so happy for you. I'm so, so happy for you. Happy New Year, Yamo. C. Gregory said, diagnosed with Hunner's lesions October 2022. Had a total hysterectomy with a bladder tuck in September 2020. Euro told me my bladder was perfect before the surgery. Had to take the tuck down and redo it. Trauma? Wow, great question. So, there are two theories as to what causes a Hunner's lesion. So a Hunner's lesion, it's basically an open bloody wound in the bladder wall. Hunner's lesions have always considered the most severe form of IC, very difficult to treat. They didn't respond to traditional therapies like Elmeron back in the day, or bladder installations. So Hunner's lesions were at one point in time kind of these were the most difficult patients, just absolutely. Okay, so now in 2024, We have much better information about what causes a Hunner's lesion. So, theory number one, but this is proven in several research studies now. But for C. Gregory, you're not number one, you're number two. But let me explain number one first. Is that it's a viral infection. That the that it was researchers in Europe who continued to find consistently virus in the urine of patients with Hunner's lesions that was not found in the urine of patients without Hunner's lesions. And so we had multiple studies that came from Europe. What they kept finding was something called the polyoma BK virus, B as in boy, K as in Kelly. And so this was big, you know. I mean, we're sitting here. If you go back and watch those streams from 7, 8 years ago, um, you know, we have all this promising research from Europe, and the Americans were very suspiciously quiet. And we're all going, "Hey guys, come on! You got really good researchers in Europe who keep finding virus. What do you have to say, America?" Well, what we didn't know is that the National Institutes of Health IT research team, also known as the MAP Research Network, and that first study came out, they decided they were going to do a study too, and they did a 5-year study. And the advantage of the MAP Research Network, that stands for Multidisciplinary Approach for the Study of Pelvic Pain, MAPP, is that they had urine stored for hundreds of patients over time. So, for any patient who was in the MAP Research Network study, they took urine samples literally at every doctor's appointment. So, what they did is they went back and they checked those urine samples. And you know what they found? Polyoma virus in about 5% of the urine samples. So, this is really something that is going to get really fleshed out in the next year or two. Okay, so theory number one, that it's a viral infection, but that's not you, C. Gregory, because we had a case study published 2 years ago, maybe even 3 years ago. And I have a blog on it on the IC Network website. So this was a woman who had very severe Hunner's lesions, and she had a severe prolapse. So this is like published in the Journal of Urology. It was again a case study. So her ability to urinate was so compromised, they made the decision to try to repair the prolapse. So they went in surgically. They made an absolutely remarkable discovery that her uterus was backwards. That the front of her uterus was facing backwards, and the back of her uterus was facing frontwards. Why? Because a ligament was broken. So her uterus was free swinging off of a ligament, right? So it was what we call a strangulation injury. It had twisted to go backwards. And anytime you see a strangulation injury, that's really quite dangerous because they can turn off blood supply. So especially in men, that's a real big issue. We want to identify strangulations early. So anyway, the surgeons were stunned, gobsmacked. Look at this. Her uterus is backwards. This is called posterior fornix syndrome. Posterior backside fornix, which is the attachment syndrome. So what did they do? They repaired it. They reattached, they turned the uterus back to where it was supposed to be, and they reattached it. And what do you think happened? Her Hunner's lesions healed completely. She is considered a complete and total cure. Now, interestingly, if you read that article, and if you go over to the IC Network website and just search for Fornix, Fornix, you can find the blog I wrote about this. And I have links to the original studies. If you go back and you actually start reading about posterior fornix syndrome, those researchers were talking about how that could mimic IC. Those researchers were talking about how any patient presenting with frequency urgency pain should be assessed for posterior fornix syndrome. And they'd been, speaking to the wind for years and years and years and not getting people to listen to them, which is one reason why they did the published case study. So, so how do they test for it? Super, super easy to test for it. So let's see, I have to draw a picture. Okay, so hold on a second. Let me draw this picture real quick. Okay. Here. That's your vagina. And let's just say, I mean, this is such an anatomically incorrect picture, but um okay. This is like guy. It's a hard thing to draw. So okay, I don't want you to assume that this is accurate. Okay. So here's the cervix. Oh, wait a sec. Oh my God. Wait a second. No, I screwed this up. Hold on. Okay, hold on. I like this. I find this challenging here. So here, give me a quick sec. Okay. Okay. So when you think about your vagina and then your cervix and then your uterus, you're thinking, well, it just it's just flat, right? I mean, you would think that you just have your vagina and then it'd basically be flat, and then there'd be a hole where the cervix is, and it would go right there. But it's not flat. It's actually kind of like this. For a good example, that it's actually very curvy and plump. And so, okay. So your cervix is not flat. It's very, very plump. And there are, um, so actually, as the vagina comes to the cervix, there are pockets. These are fornixes. So there's a pocket on this side and there's a pocket on this side. And so what they do, and the pocket is where the ligament is. So the way they diagnose to see if you have posterior fornix syndrome is they just stick a wooden speculum in this little pocket. And if they lift it up and your pain goes away, then we know you have a detached ligament. And terrible artwork. I'm sorry, terrible, terrible art. If you go back to the article on our website, it's much better. Okay, let me get a drink again. Michelle here. Okay, here, hold on a sec. So you guys remember I'm streaming on Facebook and YouTube. So when I'm looking this way, I'm looking at Facebook. When I'm looking at here, I'm looking at YouTube. So right now we got some cool questions on YouTube. So getting back to C. Gregory, I would assume that the reason why you have the Hunner's lesions is because you have some physical trauma / nerve trauma from the surgery, from your hysterectomy. Normally, when they do a hysterectomy, they do a hydrodistension to look at the bladder after they finish the hysterectomy and make sure they didn't damage anything. So to me, it sounds like you're a variation of the posterior fornix syndrome, maybe. Yelmo says, how about quercetin with bromelain, multivitamin, low acid formula, PEA 500, all those wrote. Take twice medicine, but I'm taking only one a day. I just want to know how many to take. You mean the Vibe? Follow the manufacturer's instructions. I think it's 2 a day if it's Bladder Smart. Michelle says, is bladder stretching to look for Hunner's lesions painful or harmful? I'm already in so much pain. I canceled my surgery because I was nervous from the other stories I read online. All right, Michelle, you don't need to be scared anymore. You need to be informed. In the old days, 10 years or longer, they did something called a high pressure, long duration hydrodistension. That means they used a lot of water over time to really stretch the bladder out. And obviously, that caused a lot of pain, but they don't do that anymore. Today, our AUA guidelines say it should be a low pressure, short duration hydrodistension. So instead of going for a lot of water, they're only going to use a little bit of water and they're not going to hold it for a long time, short time. And that dramatically reduces any pain or trauma from the hydrodistension. So remember that you're the boss. You pay them. They don't pay you. You're paying them for the surgery. So you get to have a say in how it's done. And so what I would do is say, okay, doc, listen, I understand that you want to look at my bladder. And I'm not against hydrodistension. If you're in pain, if you've been in pain for a period of time, of course you want somebody to look. That's my personal approach. I don't want anybody guessing. I want facts. If I've got blood in my urine, I want somebody to look at my bladder and tell me what's bleeding. I mean, a lot of blood. But if I've been in pain for a period of time, please, I want them to look. That's how I approach my personal care. And so I would say, okay, listen, I understand that you want to look at my bladder. For God's sake, I want you to look too, but I want you to minimize trauma. I do not want a high pressure, long duration hydrodistension. I've done my homework. I have read the AUA guidelines. I want a low pressure, short duration. Are you prepared to do that for me? And if the doctor says, absolutely, that's what we do, you're good. And you just say, listen, I had so much pain. The last thing I want you to do is make everything worse. I need you to be as gentle as you can possibly be. Now, if you have a doctor who says, don't tell me what to do, I'm going to do whatever the hell I want to do, that's a warning sign. And that's then I'm probably not going to want you to do my hydrodistension, if that's the case. A lot of doctors have not read the guidelines, and the guidelines are crystal clear. Our goal here is to minimize trauma now. We do not want to make things worse. And for a patient with widespread pain, and we know that we have a very, very sensitive nervous system, some doctors are going to want to go very, very, very slowly, because the last thing we want to do is do a major trauma that would amp and stimulate this already sensitive nervous system. Michelle, how long have you had symptoms? How long ago did this start for you? And how old are you, hon? How old are you? Angel says, I had my sling mesh in February, but my bladder hurt so bad to the point where with stomach cramping so bad. Okay. Diane says, I'm going to see a new doctor instead of continuing with my urologist. I'm going to a female pelvic medicine specialist, so I'm more hopeful of getting help. Good for you. Your urologist wanted to focus on treating me for overactive bladder to help with my IC pain, and I thought she was going down the wrong path. I want to treat the reason behind why I have frequency. Good. Mary says, Hunner's lesions is what I was diagnosed with back in March of 22. They explained it's my whole bladder, and I'm constantly having UTIs. I've been having an incontinent problem since about 2009. Mary, it'd be nice to know how many lesions you had because it's very confusing for them to say it's your whole bladder. Um, and when they found the lesions, what did they do about them? Did they treat them? Ayama says, is aloe vera good for bladder? I'm not as hot on aloe vera as I was years ago because we've learned a lot about icy since then. Aloe, just as aloe is soothing to a sunburn, aloe can be soothing to the bladder in some, but certainly not all patients. Um, yeah, for patients who are flaring, and they're having really strong bladder wall flares, aloe makes sense. The aloe that we sell now is called Aloe Path. It's a combination of aloe and PEA. And I think that that's more effective in the long run because we have PEA to calm nerves down. So you get the soothing effect of the aloe combined with the PEA to calm nerves down. And that's called Aloe Path. Let me see if we have it. Okay. Oh. Where is it? Oh, here it is. Oh. Aloe Path. If you can see that, Aloe Path. So the aloe path is basically organic anthracnone-free aloe combined with PEA. So you get 2 for 1 in the aloe path. So, we have patients now who are using it more for flares rather than every day. And somebody asked, what's wrong with my SI joint? I was a pretty successful professional tennis player in my 20s. While all this was actually, it started in high school though. I was really good in high school. So I played professionally for about 2 years before I realized I wasn't that good. I mean, I was good. I was ranked number 6 in California. So, but this is a tennis injury. It's a very common tennis injury. And so if you're right-handed and you step in with your left foot and you put all your weight on the left foot and then you rotate your body with all of your weight there, what are you doing? You are messing with your SI joint. And so this is an old tennis injury for me. Ugh. And I want to have prolotherapy. But COVID stopped that. When we finally figured out it was what it was, which was right before COVID, then COVID hit, and my orthopedic surgeon guy was like, "You want to do prolotherapy?" And I'm like, "Yeah." And he goes, "Well, it's really bloody." I'm like, "Oh, well, that sounds encouraging." And I need to go have that done. But he wasn't too enthusiastic about it. But as you can tell, when it gets tweaked, I suffer. And it is tweaked right now. So Michelle says, I've been on the IC diet for months now. It's not working. My pain is getting worse. My bladder feels so swollen. Even your pants are pressing in on that area. What would that next step be? So anytime your symptoms are getting worse and you're not responding to therapy, what our national guidelines from the American Urology Association say is stop what you're doing, take a step back and revisit the diagnosis. It means that the treatments that you're doing aren't treating the right thing. So you need a good phenotyping. We need to try to find the underlying cause, because if bladder therapies aren't working, maybe it's not your bladder, maybe it's something else interfering with your bladder. It could be a fibroid tumor pushing on your bladder. It could be endometriosis on your bladder. It could be very, very tight pelvic floor muscles. It could be pelvic congestion syndrome. If you feel like you're carrying a bowling ball around in your pelvis, a heaviness, heaviness. And so that's called pelvic congestion syndrome. And that is basically a varicose vein in your pelvis. It means there's a vein that has swollen and is collecting blood, and it gets worse throughout the day. And then it goes away when you lay down, and you wake up the next morning, it feels good. But as the day goes on, it gets heavier and heavier and heavier and heavier. That's a sign that you got pelvic congestion syndrome, and they can fix that. You have to see an interventional radiologist to fix that. Um, Mary said she asked her urologist about pelvic muscles and he didn't know anything about pelvic muscles. Oh my God. Then clearly he has not read the AUA guidelines. So, Mary, what you should do is you should print them out and bring them to him. So that then you can highlight, what does it say at the very first appointment? Check the pelvic floor muscles. If the muscles are tight, immediately refer them to pelvic floor physical therapy. So if you want to email me, Mary, I can send you the link on where you can do that. And it's going to be about 45 pages. Print them all out, give it to him as a gift, and say, Doc, understood. You said you didn't know why the pelvic floor is involved. Here's what your urology association says about that. You never want to say, hey, I learned about it from somebody on the internet. That's not helpful. That's going to piss them off. We want to give them the facts. And he cannot ignore the national guidelines. These are the national guidelines made by the organization that certifies him as a urologist. Arcana says, have you heard of the nutraceutical Bladder Builder? Do you think it helped? Bladder Builder is, in my opinion, the best supplement on the market. And the reason why I say that is because it has the most methods of action. It's got chondroitin for the bladder wall. It's got quercetin for an antihistaminic effect. It's got some beneficial probiotics for the gut and the bladder. But most importantly, it has PEA in it to calm nerves down. So I've been involved with that company ever since it was founded, because the guy who started that company is actually one of us. And he doesn't mind me sharing his story. He had very, very severe pelvic pain. He sent me an email. I had no idea who he was for a couple of years. And he's not a typical IC patient. He's a surgical injury patient, and had lots and lots and lots of surgery. A couple of years later, he goes, I'd like to tell you who I am. And I was like, you don't have to tell me who you are. That's fine. I mean, I've worked with actors. I've worked with congressmen, Broadway stars. I don't need to know people's real names. It's fine. And it turned out he was a big CEO who had a lot of experience, and he said he wanted to help. And so he asked what I thought he could do. And I went, well, we need some new supplements. And by golly, he's created an incredible supplement line. Mary said, all I was given was Elmeron and antibiotic. That was exactly what they told me about the lesions. My whole bladder was one complete lesion. Well, and Elmeron has not been found to be helpful with Hunner's lesions. So I don't know why they would do that. Mary, was that recent or was that some time ago? Lesions require lesion-specific therapy, which is going to be cauterization, steroid injection. They can cut the lesion out, or hyperbaric oxygen therapy. And now we have new antivirals that are being tested. Helene says, can pelvic floor flare make you feel like you have to urinate a lot, but not a lot comes out? Absolutely. Definitely. All right, let me come back to Facebook here. Mary says, got my cystoscopy results and it showed I had calcification on my trigone, but he said he didn't know the significance of it despite he's a top uro. Any thoughts on this? It sounds like they could be causing my constant pain. It sounds like you have bladder stones. Here, I have a picture. Let me find it. Okay. Oh. Okay. We're moving slow today. Yes, we are. Okay. So I guess kind of two different things come to mind. The most logical thing that comes to mind is something like this. This is a bladder stone. So what's so interesting about this is that bladder stones in can occur in areas of the bladder that have a very severe injury. So in that injury, the calcium metabolism mechanism gets disrupted and the calcium has to go somewhere. So what happens is this excess calcium gets extruded through the bladder wall where it develops stones. And what happens then is these stones break off, and if they're small enough, they'll pass through the urethra. But if they're too big, they will float in the bladder. And you can see from this picture, the stones are very rough. I mean, we know that many stones are jagged. And we also know that stones tend to be coated with a lot of bacteria, different types of bacteria. And so if you've got a jagged stone stuck in your bladder that is going up and down as your urine level rises and it's touching the wall, the bladder wall, the inside of the bladder wall, it's basically cutting the inside of the bladder wall and it's introducing bacteria. So we want to make sure, that's why it's so important to have a cystoscopy, you know, uh, within the first year if your symptoms are really, really persistent. I worked with one patient. She was too afraid. She wouldn't let anybody look in her bladder for years and years, and her symptoms were very, very severe. And finally, she said, "All right, you can look. I'm sick of this." They took one look. What did they find? What did they find? But a giant bladder stone. And they just broke it up, got it out of her, and her symptoms went away completely. And she was never an IC patient. I mean, she was never a bladder disease patient. It was just this stupid stone cutting her bladder wall. And when I asked her, I said, what do you think triggered it? She goes, "Oh, well, it happened when I was traveling. I flew to Europe and I didn't drink water. And so for the 14-hour trip from the US to Europe, I drank no water. And when we got there, I was having bladder sensitivity. And then she was drinking for that 2 weeks, like cans of Coke, because you got to be careful on your water sources. And then when it was time to come home, she did it again. She drank nothing for the day, so she wouldn't have to get up and use the bathroom on the plane. And the next day, she was just, her pain was agony. And yeah, they found that her urine was very, very concentrated, very, very irritating, and she had stones floating in it. Mary, they gave you Elmeron for a Hunner's lesion last year, 2 years ago. We should talk. Call me this week. I don't understand why they would say that, because our national guidelines say if you suspect Hunner's lesions, look for them, and then you need Hunner's lesion specific therapy, and that's not Elmeron, and that's not antibiotics. So I'm very, very confused as to why they would do that. Not to say that we also knew that Elmeron was linked to eye issues back then. So the use of Elmeron is now much more um, Spartan, for lack of a better term, because we now know that Elmeron is associated with pigmentary maculopathy and now, as of last year, inflammatory bowel disease. So most patients who were using Elmeron who do not want to use Elmeron have switched over to supplements like Bladder Builder or Bladder Rest or Cystomend or Cystoprotect. Mary says, "Happy New Year, Jill. I got my." Oh wait, we just did yours. Sorry about that. Okay. Anne says, "How does an OBGYN treat pudendal neuralgia? They're going to calm the nerve down, perhaps with nerve blocks, and send you to physical therapy." Mary says, "Lots of these docs have no idea what to do with us. They deal with men mostly, and they don't like patients telling them stuff." Absolutely. Some doctors have very strong egos, and they are not interested in learning from patients, which is a shame. Shanna says, "But does anybody have burning mouth syndrome? I understand it could be linked to perimenopause. I also have IC." Yeah, burning mouth syndrome is very commonly associated with menopause because with the loss of estrogen, the mucosal layer in the mouth becomes thinner. The nerves become more exposed. Thus, the nerves can burn more easily with foods and stuff. So yeah, that's very, very common. I've had moments of mouth pain, especially with my magnesium. My magnesium it's weird in my mouth and it can really burn. Marlia says, "About 3 weeks ago, I took PA and I was so looking forward to using it to help my bladder. So about 2 hours after taking it, I bent over to retrieve something that fell under my chair and I had the worst dizzy spell and the room started spinning. I sat down I focused my eyes straight ahead and it took away. It scared me, so I haven't dared take it again. This never has happened before. It may have just been a coincidence, but have you ever heard of this?" No. Honey, Marlia, um, PEA, there were no side effects reported in the IC study. There are no side effects reported in the vast majority of IC studies. I mean, just pain studies out there. Dizziness. Let's take a look. Let me just go to the National Library of Medicine and let's see if anybody has. So PEA, palmitoyl ethanolamide, is naturally produced in many plant and animal food sources, as well as in cells and tissues of mammals, and is endowed with important neuroprotective, anti-inflammatory, and analgesic actions. So this is a paper that goes through the pharmacology of it. Let me see if I can find. They're actually testing it for patients with neurodegenerative diseases, that it has neuroprotective actions, testing it with multiple sclerosis, encephalomyelitis, traumatic brain injury, ischemic stroke. I mean, it's been used to help these patients who have these. PEA and pain perception. Um, let's see. Hold on. Is this going to let me? I'm just looking for a paper. I'm not seeing it, but I believe you. And you may be sensitive, and you're the only person living in your body. If I mean, I take this myself. I've never had an issue with it, but I'm not you. And if there's something about your body that doesn't like PEA, then for God's sake, don't do it. It could relate to blood pressure medicine. Now, I have gotten dizzy with my blood pressure medication. So I don't know why that happened to you, Marlia, but I think you need to trust your gut, talk to your doctor. Um, I would certainly stop the PEA for at least a month, and let's see if you have any other episodes. Because if you are, that just means that something else might be going on that you're going to want your doctor to look at, like a blood pressure issues or a reaction to other meds. And Anne, who is a dental hygienist, says burning mouth syndrome can be a B12 deficiency. True. Thank you. Mary says, "Oh my God, this happened after a long flight to Europe, but why wouldn't he remove them or say he doesn't know its significance?" I don't know. I mean, I think you need pictures of it. Did he take pictures of the calcification? I mean, is it in one lump or is it kind of diffuse? Have you gotten kind of an area of your bladder wall that's just kind of harder and stiffer because it has calcium on the surface? I just don't know. Hi, Sue. Aaron says, I too have burning mouth syndrome and I see. Mary said, also recalcification. Is it possible it's embedded there, not floating because then you see it? It could be. Yeah, because the picture I showed you, I mean, this is embedded in the bladder wall. This is not floating. This is sticking out of the bladder wall right there. And there's another one sticking out. So here's one sticking out. Here's one sticking out. This is a big one sticking out. You can see a little one right there. These were all coming out of this gentleman's bladder wall because, again, this was an area where they had, well, it's a long story. I don't need to, it's just massive injury. I don't know, Mary. Funky. Michelle says, how many allopath do you start with a day? One. We never suggest starting with a full dose of anything. I think it's very, very important that you go slow. Try one capsule, wait 24 hours, see how you feel. Do one a day for a week, see how you feel. If you feel okay, you can go up to two a day. I'm not somebody who believes in taking more and more and more and adding more and more. I'm not convinced that that makes the supplement companies a lot of money, but I'm not sure that that's effective. I go for low doses. I think we look for something called the lowest effective dose. So I think that, let's see, how many is this? They want you to do, you can do 3 in the, well, let's see, you know what? Is this an old one? You can do some in the morning, some in the evening. You can work your way up to 6, but start with 1, go slow. You can go to 2, go slow. You can go to 3, just see how you feel. Some people who take aloe or any of the supplements get stomach aches. That's why we want you to go slow. Hi, Dolores. In the great state of New Mexico. I would love to visit New Mexico. I had a job there that got canceled. Peggy says, I was put on Urabel. I read up on it and found some interesting information on it. Supposedly makes the urine more acidic to kill bacteria. Something about formaldehyde. Look it up. It has 5 different meds in it. I started it a week ago and I'm worse now than before. So Urabel is that kind of comes from that old mistaken belief that anybody who has bladder symptoms has infection. And so they're assuming that bacteria is an underlying problem in your symptoms. But if you are, for example, an estrogen atrophy patient, a genitourinary syndrome of menopause patient, Urabel makes no sense because here you've got a bladder that can't protect itself because it doesn't have enough estrogen. And now you're going to pour something put something in it that's going to make your urine even more acidic. Urabel doesn't make sense for patients with estrogen atrophy or makes sense for patients with Hunner's lesions. Because if you're following the pathogen theory, they need an antiviral, not an antibacterial. There are no known drug interactions with PEA, but I encourage you to Google it and read about it for yourself. Diane says, I'm switching from a urologist to a female pelvic pain specialist because my uro wants to treat the OAB. That's right. Okay. Gwen says, can you let me know if radiation injection for a heart stress test will flare the bladder? They say it's a blood vessel dilator. I'm not aware of patients who have suffered big flares from that. I can't remember anybody who's ever called about that. Helene says, can PEA be taken with gabapentin that you know of? There are no known drug interactions with PEA. I Google that every couple of months just to look for any new research. And the last time I looked was maybe 2 months ago, and there were no known drug interactions with PEA. But let me spell it out for you. Here, hold on a sec. I'm going to give you the scientific name. I want you to Google it. Just cut and paste that, Helene. Put it in Google and see what comes up. I'm not aware of any drug interactions for PEA. All righty. Give me questions. Any questions, thoughts, concerns? Carolyn says, can estrogen atrophy cause frequency urgency? Absolutely. It is the dominant cause of quote unquote IC in women of a certain age. In fact, it was our theme for IC Awareness Month. If you read our press release for IC Awareness Month in 2023, it was about educating the public that millions of women have been told that they have an incurable bladder disease when in fact they just have estrogen atrophy, also known as genitourinary syndrome of menopause. And in that case, that's not a disease. That just means the tissue is dry. Your bladder is wet on the inside. Your bladder is like your mouth. It's a hollow organ covered with a really thick coating of mucus. And the purpose of that mucus is to protect the tissue. But unfortunately, it's estrogen dependent. So when you're young and have lots of estrogen, you have lots of mucus. When you're older, you don't have the estrogen, therefore you don't have as much mucus. Therefore, your bladder's ability to defend itself is compromised. So that cup of coffee you might have had in your 40s and your 50s all of a sudden starts to hurt. Of course, the first symptom is frequency urgency, and that patient immediately assumes that they have an infection. The culture comes back negative. So estrogen atrophy is real. It will directly affect the bladder wall. It will directly cause frequency urgency. Gwen says, still struggling, need to just find foods that I can tolerate. Okay, then you do the test. You need a colonoscopy, um, but you can't tolerate the Marlas. Makes me vomit. Any idea I could ask for? Miralax. They have some new colonoscopy preps that are pills that you don't have to swallow massive amounts of fluid. And so I think you can just tell your doctor that you have a very, very sensitive bladder and you really don't want to do that big acidic prep and see if they'll give you the pills that will do it instead. There are definitely new ways of emptying the bowel without having to drink copious amounts of Go Lightly. Diane says, I got COVID last week and I'm better, but worried I'll have more IC pain. Is there anything I can do now to prevent this? I should have gotten a vaccination. Diane, I'm so sorry that you got COVID. I think you'd know by now if the COVID was going to flare your bladder. I see patients who have gotten COVID, but 75% do report worse bladder symptoms, but they get better over time. And it doesn't normally cause more pain; it causes more frequency, urgency. But the fact that you're doing well now means that you probably don't have to worry about it. I wouldn't worry about it too much, hon. I just wouldn't worry about it too much. I think it's very important that we all understand the greatest risk of COVID is long COVID. Vivian, honey, completely inappropriate to come into this and try to sell something. You are banned. You know, one of my resolutions for this year, to be quite honest, is I'm honestly sick of the internet. I'm sick of Twitter. I'm sick of polarization. I'm heartbroken by all the conflict it has. And um, you know, back when I started the first IT support groups online, the internet was not what it was like back then. Back then we were all people, doctors, researchers, patients working together for something better. And we didn't have all this political conflict and we didn't have all these people who were insulting, deliberately hurting other people, and companies that are purposely trying to make you upset to keep you engaged. The internet has become so toxic and it's become so heartbreakingly manipulative by dark forces and people who don't care, or people who are trying to make a quick buck, which is why this is free. I don't ever want you to think that I do that. I've spent 30 years being a support group leader. But for my own state of mind, man, I just, at the end of the day, I just can't look at it. I just, it's too painful. And I need a year of happiness. I don't need which is going to be hard with an election year, let me tell you. Um, I'm much less inclined to be online. I I I can't stand I can't stand much of what I see. It's not healthy for me. It's not healthy. I'd rather get outside and go sit in the garden and or go take a walk, anything to get myself outside into the sunshine. Lori says, update. Going to the bathroom every 3 to 4 hours. V Magic is great. It's really helped me. Estrogen cream is doing wonders. My 5th week. Going to pelvic floor therapy starting this week. Yeah, baby. Lori, excellent. We love this. So you are a classic estrogen atrophy patient. And it's working. Isn't it nice to know you don't have this weird incurable bladder disease? Isn't it nice to know that this can actually be treated? And you're doing it exactly the way it should be done. You're working on the quality and health of your skin with the estrogen, and you're going to go work with the pelvic floor physical therapist on your muscles. Bravo to you, girl. Excellent. Uh, Patricia says, my IC is so much more tolerable when I stick to using the estradiol vaginal cream. Exactly. Also using a compounded script of lidocaine mixed with a tiny amount of Valium vaginally, and I have my life back. Exactly. Isn't it great, Patricia? They were finally treating the underlying problems with really, truly effective treatments. Elmeron would never have done what your estrogen is doing for you now. Let's see. Carolyn says, if I have a weak bladder wall, is there any internal work for this problem? I was only told to do Kegels. Well, the question is, why is it weak? Is it thin because of estrogen atrophy? If it's thin because of estrogen atrophy, topical estrogen is going to help that. Topical estrogen will help that skin get strong and healthy. That's separate and distinct from the pelvic floor. If your pelvic floor muscles were weak, then you'd be struggling with incontinence. And that's when, of course, we do Kegels. But for those of us who have tight muscles, Kegels make it worse because our muscles are tight. The last thing we want to do is make it tighter. Carolyn says, meet the vaginal wall. Well, you have to work with a physical therapist to really try to understand the mechanics of what's going on in there, hun. Oftentimes, what happens, remember, with the loss of estrogen, muscles get weaker. I mean, unfortunately, that's what happens as we get older. And as those muscles get weaker, if it's, as the pelvic floor muscles get weaker, then we can start having some leakage. And so if you find that you're starting to dribble, even just a little drop of urine, even just if you feel it going into your urethra, it might not come out. That's when um, we have to identify that we've got weakness going on. And then sometimes what happens then is the shallow muscles get super, super tight to compensate for the weak muscles that are deeper. And so from a therapeutic standpoint, they have to release the tight muscles first, and then they've got to strengthen the weak muscles. It's a little tricky. That's why you want to work with a physical therapist if you have a complex situation like that. So Lori was saying before she began all this, she was peeing every hour. She had severe pelvic pain, constantly thought she was losing her mind, burning sensation. And I felt like everything was hanging out, and it wasn't. And so now, now she's going to the bathroom every 3 to 4 hours. She's using V Magic to help her skin, estrogen cream to improve the health of her skin, and she's doing physical therapy. So look at that. Already doing better. Love it. Lori says, will PEA help tighter weak muscles? No. PEA calms nerves down. It doesn't do anything to muscle fibers that I'm aware of. Stretch. I have been walking like a beast, but I gotta say, my muscles are just not happy on my left side. Yep, there it is, the left psoas. Oh, I am undoubtedly, after we're done, going to be laying in my recliner with a heating pad on my back and on my hip for the rest of the night. um, my symptoms have flared out 100 times worse after a 14-day round of antibiotics. Could this be related? It could be. The bladder can be injured, and generally it's injured through a chemical exposure, and usually that chemical exposure can be from something like Diet Coke or coffee, but there are some antibiotics that are well known to irritate the bladder. Um, Generally, if you start antibiotic, things like Augmentin, a really strong antibiotic. So let's just say you have a sinus infection and your doctor wants you to use an antibiotic. You got to pay attention the first couple of days. If that antibiotic is really flaring you, call the doctor back and say, hey, this is killing my bladder. Is there another one we can use instead? That happened to me once. I remember it very, very distinctly. And it just made my bladder was just on fire like day two or day three. And I just called and said, listen, I need a different one. This one hurts. And he's like, okay, not a problem. We'll give you a different one. Gwen says, how long does it take the estrogen to help? A couple weeks. And do not be dismayed or alarmed if you try estrogen for the first time and it burns. That's to be expected. If your skin is super, super dry, anything you put on it's going to burn. You got to ride through that burning because every time you use the estrogen, your skin gets stronger, the cells get stronger, and they produce more mucus. So the burning will diminish fairly quickly over a week or two. But don't let that first burn scare you. Now, for a lot of patients, it doesn't burn at all because their skin is pretty good. But if you have avoided estrogen for years and years or decades, then that skin is super, super dry. And the odds are estrogen, the first couple of times you use it, it's going to have a burning sensation, but it will go away as the skin improves. Arcana says, I got access to the internet in 1997. It was novel and people were excited to interact with each other easily. Yeah. I built the IC Network website. I took the very first web programming course in the summer of 1994 as I was trying to figure out what the hell I was going to do with my life since I couldn't work or drive in a car because it was so bad. Somehow I got myself to my local junior college and took a night class. I took the very first web development class I think ever offered in Northern California. And the IC Network website was my student project. And now 30 years later, it's still obviously it's a massive website now and it's rated the most accurate, reliable website on IC by Harvard and the University of London, and I'm damn proud of that. Arcana says, I have a master's in cybersecurity. I've had to deal with fraudsters, criminal games, state-sponsored organizations. Saying the internet has changed is not an understatement. Yeah, yeah, I'd love to talk to you sometime about it. One of the things that I just had to learn early on is there's no business owner or out there who can stay up on security. It's impossible. We had our own server for many years. Oh god, the early days of the IT network were interesting back in the 90s. Um, but I ended up buying a server, and all of our because we have about a dozen websites. We have a bunch of different websites, all related to pelvic pain, like hunterslesions.org and COVID cystitis and stuff like that. Um, ITawareness.org, ITawareness.com. So I put all those websites onto our server, right? But now I was responsible for security on that server. And the server logs stunned me that literally every minute of every day somebody was trying to break in. I was shocked. I was absolutely shocked that literally every minute of every day people were trying to break into our websites. And finally I just like this is way too hard for me to be up, now I practice a divide and conquer strategy. So like the IC Network website, which is our biggest, most important website, lives on the most secure server in WordPress, WP Engine. Our e-commerce is over on another website. All my other websites live on GoDaddy. And I've got one on Wix. Oh, so many things to do. There's so many websites I'd like to build. I just don't have time. um, okay, hold on a sec. Okay. Lori said, I suffer from L5 pain too. It sucks. Yeah. My L5 pain is manifested in my right thigh. It's like there's a tight rubber band around my right thigh. And this again happened 2 years ago. So I wear a knee brace. The only way I can make it go away, if I don't have my knee brace on, it's like there's a tight belt around the upper part of my knee, and then down here, and then a tight belt here. But if I put a compression brace on, it all goes away. Getting old sucks. Injuries suck. Mary said, any idea how I should approach this calcification with my dog? Getting another opinion. I'm in daily pain. Yeah, I mean, I really think that you need to maybe go to the National Library of Medicine and see if you can find any articles on calcification in of the bladder wall. I mean, here, let's just look right now. Hold on. Let me go look. And let's see if we can find any, okay. Calcification. Let's see. Diffuse bladder wall calcification in a survivor with, oh, look at this. Wow. Oh, wow. Holy moly. Wow. Hold on one second here. Hold on. Bladder calcification is a rare presentation that was first interpreted to be related to urea splitting bacterial infection. Aside from infection, other hypotheses include schistosomiosis, yikes, tuberculosis, cancer, and inflammatory processes have also been reported. Severe COVID is known for its provoking cytokine storm, an uninhibited systematic inflammation, and calcification over the coronary artery or lung has been reported as a long-term complication. We present a 68-year-old man with persistent lower urinary tract symptoms after recovery from severe COVID with no bacteria found. Cystoscopy revealed diffuse bladder mucosal and submucosal calcification. So what did they do? They removed it with a lithotripsy, and the patient's lower urinary tract symptoms improved. Stone analysis showed 98% calcium phosphate, 2% calcium oxalate. No newly formed calcifications were found at serial follow-up. Conclusion, the diffuse bladder calcification may be a urinary tract sequela of COVID-19 infection. Patients with new lower urinary tract symptoms after severe COVID should be further investigated. Woo! Wow. I gotta add this to our COVID cystitis website. Okay, so that's one. So, Mary, did you have COVID? Let me know if you had COVID. Holy moly. Yeah, but did you have COVID? Patricia here is okay. Lori says my estrogen cream burned the first two times. The next day I felt a little burning, but it stopped. And then Patricia said, "You're so right, Jill. I gave up on the estrogen at first because of the burning, but stuck with it as I remembered what you said, and I'm so grateful I did." Okay, so hold on one sec. So hold on a sec. It also described calcification of the bladder wall after mitomycin C therapy. Somebody who developed extensive bladder wall calcification within 3 weeks of being treated with just a single dose of mitomycin. Okay, wait a second here. Wait. Oh, okay, hold on. What? This is a series of 19 patients with radiographically visible bladder wall calcification. Okay, I'm having a brain freeze. Hold on. God, I swear. Where did I see this? I just saw, like, in the last 2 weeks. Oh, it was a calcification of multiple organs. Anyway, so this is how to diagnose it. They can see it with an X-ray potentially, along with lab studies. The question is treatment. So hold on. Bear with me here, guys. Oh, that 1989? No. That's way too old. Okay, here's 2020. So you're not being treated for any cancer, are you? Mary, you haven't had cancer? Today, only 6 other cases were reported in scientific literature, all of which used higher doses of mitomycin. Huh. Well, obviously, we can really dig about this, and I would be happy to send some email if you give me a phone call. Sometimes what I do is I write up case reports and I send them to the top doctors in the country for feedback. And having a bladder wall calcification, I would consider to be a very rare and unusual thing to be happening. And so if you call me, maybe we can write up a little case report and send it off for some opinions. Marlia says, one time you said you took Gaviscon. Do you take it to make your bladder more alkaline, or what is the advantage of Gaviscon? You said it bubbles up as it helps in bladder inflammation. No. I take Gaviscon if I have gas on my stomach. I don't take Gaviscon for my bladder at all. I take it if I have gas on my stomach, which I'm prone to have every now and then. Paula says, I started with estradiol, cut alcohol, coffee, reduced sugar. I take a bladder relaxer and I'm starting to feel better, but I'm still terrified to use the bathroom and have intercourse with my husband. Okay, hon, but listen, that okay, so there's two fundamental reasons why sex would be painful. Number one, that you're very dry because dry skin on dry skin hurts. And so we want to make sure that you use a lot of lube when you're struggling with estrogen atrophy. You got to be real slippery. So like a half a tube of KY per sex act, literally, just to protect that skin. But the only other reason why sex would be painful is if your muscles are tight. And so doing pelvic floor physical therapy would fix that. So if you've got funky muscles going on, then get yourself to physical therapy and that should help tremendously in making sex more comfortable. Mary, you're fine, honey. You're fine. Hold on, let me go here to YouTube. Arcana said, I can totally relate with the logs. I'll send you an email. Yeah, that'd be fantastic, hon. Michelle says estrogen on the vulva too and the urethra. Absolutely. Absolutely. If you're having urethral sensitivity from estrogen atrophy, generally they will have you rub a pea-sized drop of estrogen cream right into the entrance of my urethra, of your urethra. And that's where I tend to use mine, is more on my urethra. Okay, time for a bathroom break. Let's take a quick bathroom break while I slowly walk to the bathroom, okay? Oh, wish me luck. Okay. Ow. All righty. Getting cold. Oh, this is so annoying. I don't know what I did to do this. I was sitting at the kitchen table on my laptop. Kayleen knows. Kenneth, Ken, Ken. He's the chairman of the urology department at Corewell Health in Royal Oak, Michigan. All right, guys. Well, listen. As you can tell, I'm hobbling. I have a very unhappy SI joint right now that wants me to use a heating pad. So I'm going to do a last call for questions. Last call for questions. Any other questions out there? All righty. Well, Peggy says go rest. Ah, it's always something. I'm very happy it's a new year. I'm very happy. I feel like 24 is going to be a good year for us. I think IC research is looking fantastic for this year. We've got 3 clinical trials right now, which look fantastic. For anybody struggling with pain, please go to the front page of IC Network, icnetwork.org, and go to the clinical trial with the yellow picture because that's testing a new pain method. And it's very, very promising. So these clinical trials, they looking great. The IC movement's looking great. I'm very happy with what I'm seeing. Lots of good conversation behind the scenes, lots of good conversation about new lines of research, lots of new conversation about creating new resources for patients, because we know that you're the ones that have to take charge, and the way you take charge is with knowledge, so that you can have a really good discussion with your doctor. See, my hair is filled with static right now. It's just flying all over the place. The weather is so weird here. It's crazy. Dolores says, "Does estrogen cause a yeast infection?" No, no. The only thing that's going to cause a yeast infection is uh, introducing yeast to the area and or feeding that yeast by eating a lot of carbs and sugars or taking antibiotics, which kill the good bacteria, which normally keep the yeast in check. But estrogen actually should help because estrogen will help that cell produce more mucus so that it can protect itself from yeast. Michelle says, I cry a little each day, but try to walk and meditate. But this has greatly changed my life in a bad way. A lot of pain feels like pressure, nerves burning. In March, you recommended you've only done the IC diet so far and supplements. Girl, listen, if that's not getting you where you need to go, then we need to be tackling that in a new way this year. Why don't you give me a phone call this week and I can try to phenotype you a little bit more, see if anything's been missed, and then send you back to your doctor with a whole new set of questions. Yeah, we got to know what's going on with your muscles. We got to know if there are any other potential conditions that can be playing a role in your symptoms. Carry hope in your heart, my friend. Carry hope in your heart. You've not had a cystoscopy or bladder stretch to check for lesions or installations. Where should I start first? By doing avoiding diary. What you need to do, honestly, for at least a week, is avoiding diary, and let's track your urination. Let's track your frequency. So write down the time that you peed, estimate the volume. You don't have to measure, just estimate the volume, and rate your pain scale. And at the same time, you can make an appointment with a urologist, or if you think it's more related to estrogen atrophy, a gynecologist. You can, Michelle, it's hard to say, hon. Really, if you could just give me a phone call this week and let me ask you a few more questions. And then, I might be able to help figure out where you can go for your next set of help, right? Mary says, hope you feel better soon. Sorry to ask, what time do you start receiving calls? I start answering the phone usually between 10:30 and 11, but not on Monday. Yeah, don't call me Monday. Oh, Michelle, so you're gonna call me tomorrow, so you see him on Tuesday? Um, Michelle, go ahead and call and leave a message, and I will check the messages and I will call you back. Or if you email me, icnetwork@mac.com. If you can email me, just say that we talked and you have a doctor's appointment on Tuesday and you wanted to check beforehand. I will try to give you a phone call tomorrow. Email me your number. Again, icnetwork@mac.com. Just know that I have a big presentation I've got to do next weekend. And so tomorrow I'm going to be, and it's for a whole bunch of doctors around the world. So tomorrow I have to work on my presentation. Ah, Paola says, I'm starting therapy for depression and anxiety tomorrow. Good, good, excellent. Never ever suffered from depression until now, but the estradiol is helping so much. Yes, hopefully after therapy, I won't be scared to use the restroom and I will have less stress to have intercourse with my husband. October started my nightmare, but I think I'm getting better every day. So Paola, the fact that, I was just reading it. Where did I put it? Here. This is my latest pile of articles that I read. No, that's not it. Hold on. Hold on one sec. Oh, ow. I was just reading this morning a article on how menopause can trigger depression and anxiety. And I literally was reading it 4 hours ago at my kitchen table, but it's not in my pile. But it's here somewhere. Oh, is that it? Wait a second. Oh, here it is. Here it is. Mental health and emotional well-being in perimenopause and menopause. And it's called Balance, the Menopause Support App. And I thought this was really good. If you're experiencing perimenopause or menopause and have started to think, feel, or do things that are different to before, this booklet is for you. Psychological and emotional changes are extremely common when your hormones start to change and decline. And this booklet will show you what to look out for, help you understand why these changes happen, and give you the options and information to decide how to get help. Right? And there was something in here that I highlighted it. So let's see. Here, let me just read parts of it. It would be nice if I had my reading glasses on instead of my computer glasses. So, I started the IC network when I was 34. It's been 30 years. I'm going to be 64 this year. I have to wear glasses now. Okay, the perimenopause and menopause can cause a wealth of changes to your body, mind, and emotions. Physical symptoms like hot flashes and night sweats are well known, But many people do not realize the extent and nature of the changes that can occur to your mental state and emotional well being during this transition. Around 60% of women are likely to experience peri and menopausal symptoms, and 20% are likely to find the symptoms so severe or to find that their symptoms are severe, and this can have a detrimental impact on that person's quality of life. Um, Feeling sad, upset, and worried at times are part of being human, and these feelings vary over weeks and months and over the whole course of our lives. It is entirely normal to feel irritable, angry, anxious, or low, but during perimenopause or menopause, the normal ranges and frequency of these motions can change. For some, the change can be significant, and these feelings can last for a long time. The question you have most probably asked yourself is, quote, am I feeling down, anxious, emotional because of my hormones, or is it just me? You're certainly not alone in wondering this and perhaps even being troubled by this question. Um, and then to talk about this is interesting. So estrogen helps regulate several hormones which may have mood boosting properties, for example, serotonin, norepinephrine, and dopamine. Estrogen also helps to support the sharpness of your thinking skills, and when levels reduce, it can lead to forgetfulness or brain fog, which can in turn lower your mood. Some studies suggest that it is a decline in estrogen that leads to a lowering of mood, though other studies propose that it's the fluctuations. And then it said for progesterone has a calming effect on your mood as well as in aiding sleep and relaxation. Unlike estrogen, when progesterone levels drop during perimenopause and menopause, it can cause a rise in irritability, mood swings, and brain fog. Some individuals are sensitive to progesterone and they find that when their progesterone levels are higher, they can have symptoms also. And then, of course, testosterone is another hormone produced by your ovaries. Levels usually decline during perimenopause and menopause. Testosterone is thought to have important effects on your mental stamina, quality of sleep, clarity of thought, and concentration, which can in turn impact your well being and levels of stress. Anyway, it talks about depression, anxiety, intrusive thoughts, suicidal thoughts, reduced motivation, feeling flat. Hi, Bonnie. Lots of confidence. Um, okay, hold on. Where's the section that so what do they want you to do? Routines that help and not hinder sleeping well. Try to aim for 7 to 8 hours a night. It's really hard when you got to pee all the time. Keep your bedroom cool and dark, free from unhelpful distractions. In other words, don't bring your iPhone into your bedroom. Using an app like Calm if you struggle to if you struggle to get sleep. There's other apps like Sleepio, Sleep Station, and Pzzz. Stay physically active. Exercise is not only important for your physical health, it does wonders for your mental health too. Try and do a mixture of physical activity at least 3 times a week that raises your heart rate and boosts endorphins, like running, swimming, brisk walking, as well as lower impact but restorative activities like Pilates and yoga. Combining physical activity with moments of meditation or breathing techniques to aid relaxation, like those often included in yoga or Tai Chi, can be really useful. The right type of exercise for you can improve your concentration and memory and prompt the growth of new brain cells. Please yes, we need more brain cells. Doing exercise outside is even better as natural light helps to reinforce consistent sleep and wake cycles. They want you to stay mentally active, doing puzzles and things like that. I have a book. I love algebra. I loved algebra in school. I hated calculus, but I loved. So I actually got like an algebra workbook just to play with. I haven't done it in a while though, but I should. They want you to eat well. Foods that are important for perimenopause and menopause are those rich in calcium and vitamin D for your bones, friendly to the gut like pre and probiotics, carbs that are low in the glycemic index, and foods rich in omega 3s. Try to keep processed foods to a minimum, as well as foods high in salt and sugar. Cut out unhealthy habits like alcohol. Alcohol is a depressant, meaning it can disrupt the balance of neurotransmitters in your brain and affect your feelings, thoughts, and behaviors. You may feel more relaxed and less anxious and more confident after a drink or two, but these drinks quickly wear off. It can be tempting to ward off unwanted emotional difficulties with a drink, but there is danger in becoming dependent on this short term fix. The chemical changes in your brain can lead to more negative feelings such as anger, depression, or anxiety. It also slows down your brain process, how your brain processes information, making it harder to work. I gotta say, for the first time in my life, I was really tempted to drink. Um, dealing with such severe grief, just you just want to escape it. And I didn't. But I can completely see why people would start drinking after horrific stress, and it just breaks my heart for um, um, people who have been lost violently and their families and victims of war and all that sort of stuff. The trauma is just, I mean, my parents had the best life and death they could have had. There's no regrets for that. I can't even imagine how you would cope with, you know, violence. Smoking, this says stop smoking, stay connected with others, but more importantly, making time for you. Spending time doing things you enjoy helps you feel better. So add a bit of me time to your to do list and stick to it, whether it's going for a long walk, having a meal with a friend, or spending much needed time by yourself. Learn to protect and value time just for you. And they say if you have children that are now of an age where they can be left alone, it's time to reconnect with hobbies and interests you may have given up years ago. Find that thing that lifts your mood and brings you moments of joy. And then I guess one of the things that this talked about, and I hope this is useful, um, watch your thoughts. It is a useful practice to check in with your thoughts and feelings and recognize what your current emotions are. But for some of you, you may be only too aware of these feelings, and they can be all consuming. In this case, it may be more useful to step back and try to gain some distance from the emotion so you can think about other things more clearly. A useful way to turn off the constant bombardment of unhelpful, negative thoughts is to practice mindfulness. This is a popular approach for coping with feelings of low mood. Paying more attention to the present moment, including the sights, the sounds, the smells around you, as well as noticing um, what your current thoughts and feelings are, can improve your mental well-being. So instead of being caught up in your thoughts, reconnect with how your body is feeling in your environment. Gradually, you can train yourself to notice when your thoughts are taking over and realize that thoughts are simply just that. They do not have control for you. And that really resonates for me because when you have anxiety disorder, you live in a world of fear and a world of catastrophic thinking. And you can also live in a world of why me. You can also live in with thought, just a constant thought process of why is she better and I'm not? Why does my sister get to do things but I don't? And especially when you're younger and you're comparing yourself to other people, there's a lot of, and especially if you have a hard breakup, you know, um, it can be very, very easy to get lost in those, or to not get lost, to be dominated by thoughts where you question yourself. Wasn't I good enough? Um, and I think as I've gotten older now, I realize that I have to look at situations in a much more different way. And if a door closes, that's okay. Um, there's this great quote that there's some people who come into your lives and they're going to be there forever. You guys are meant to be friends, like me with my best friend from high school. And there are some people that come into your lives and they're only here for a short period of time and then they go. And whether they go because your interests have changed or whether they go because their lives have changed, they've moved away, I don't look at those as bad things anymore, as negatives anymore, or any reflection on me. I think I'm much more receptive and patient to the concept that if a tie breaks, maybe it was meant to break. Maybe there's somebody new that I'm meant to work with or I'm meant to be with. I hope that that makes sense. I don't worry so much anymore about um, what other people are doing and what other people are saying. I'm living my life. The only person whose opinion should really, let's see, I'm not saying that right. Um, when you've been on the internet for a long period of time, you have to develop very, very thick skin because no matter what you do, there will be a critic. No matter what you say, there will be someone who will criticize you. And you can't let a complete stranger destroy your day. So if you make a post about something you love, regardless of what it is, and some idiot comes along and says, well, that's just stupid, and really minimizes you, and you don't even know who this person is. You have no clue who this person is. You can't spend hours and hours wondering what you did wrong to a complete stranger. You didn't do anything wrong. That's somebody who just wants to pick a fight. There are people out there, no matter what you say to them, they're going to be angry. And I'm well past the point of letting a complete stranger let upset me for any great period of time. The people who can upset me are the people that I'm with every day. I don't give a complete stranger the power over my self-esteem. And I think that that's something we all have to learn on, because now we know that there are foreign actors on the internet. The internet is heavily used by foreign governments to try to destabilize democracy and destabilize countries where democracy happens. And anything that they can do to create a fight, they're going to create a fight, and they're going to attack anybody who speaks out. And so, you know, it's kind of like we need to put a filter on on anything we read and understand that we can't trust it so much anymore. We can't trust a lot of those random comments anymore, nor should you. The people you should trust are the people that you're with every day, hopefully. Wrong glasses. Now we're back to the computer glasses. So I can find the link for this article, and I will try to put it up on our Facebook page if anybody wants to read this thing about how our mental health changes with menopause. Um, I think one of the best mini sermons or whatever I listened to was from somebody who said, listen, 25% of the people you meet, you're going to love and they're going to love you. going to be great. 25% of the people you meet online, they're going to hate you. They will always hate you. 25% of the people you meet online, they're going to like you at first, but their opinion can be changed for the worse. And 25% of the people you might not like you, but their opinion can be changed for the better. And not to exhaust yourself trying to convert the 25% of people who really don't like you, because they will never like you. And that's okay. We're not everybody gets along with everybody. And the gift of the way that that was said to me is that really helped me stop trying to convert people who disagreed with what I was representing at the time. And a lot of it had to do with the election in 2016. Um, um, so I guess the moral of my story here is get offline and go outside into nature as much as you can, because I think we're really suffering now from really bad interactions on through social networking, and I think we're being manipulated to a certain degree. And I don't want to manipulate anybody. My job as a support group leader is to educate, inform, inspire, and then kick you in the butt and get you back to the doctor with a new set of questions. And that's what I want to do. That's my goal of doing these support group meetings, is to just give you a new perspective, give you some new education, give you some new comfort, and helping you understand that you're not alone. You've done nothing wrong. You're seeing the face of somebody right now who's been in your shoes. And I'm better. I am massively better. I don't have bladder symptoms anymore. It's very rare. Like I said, I had like a 1 to 2 day flare where I had a little bit of bladder sensitivity over the holidays. It was driven by tight muscles. I dealt with the tight muscles, and now I'm back to drinking lemonade. Why can I do that? Because I have a completely healthy bladder. It was never my bladder. It has always been my muscles. So ultimately, in the end, I want you to carry hope in your heart. You're not alone. You're not damaged goods. And if there's anything we can do to help you, we really want to do it. I really want to try to do it. But I'm not your doctor. I can't give you medical advice. My job is to educate. And if you disagree, that's fine. And if you agree, that's fine. It's all about learning as much as we can so that you can find resources that work for you. Not everything I say will be relevant, but hopefully you've gotten at least one kernel today that might be a little bit helpful. Dolores says, cough syrup seems to flare me up. Diagnosed with a sinus infection, had a cough and prescribed Z-Pak, had a bad flare up. I feel like I'm getting terrible. Feel like I'm feeling better, then I get terrible pain, like the pelvis is disconnected from the spine of my legs. And then Deb says, I have the same issue with the ingredients in cough syrup. Hard to know which is the lesser of two evils. Hope you're feeling better soon. Well, also too, make sure that it's not COVID, because it's very common for IC patients to flare when they get COVID. So do your home COVID test too, just out of curiosity. Paola says, do we stop using estradiol while with our period? No, not necessarily, but normally your periods are very close to stopping. So, once you have a certain age and your periods stop because you're menopausal or postmenopausal, then it's not that much of an issue. Peggy said, since I first talked with you back in April of 23, I've learned so much from you and all the people from this group. I feel 2024 is going to be a better year for myself because of you. Thank you so much. Lots of love, Peggy from New York. You're very welcome, honey. You're very welcome. All right, my friends, I'm going to go get a heating pad, and I got to go calm my SI joint down. So I'm going to call it here. I wish you well. We will see you next week, hopefully. Knock on wood, knock on wood. Dolores said, it is crazy. It seems like a battle. I'm from New Mexico, and we have red and green chili, and I have had to quit that. and not having coffee is hard, but keeping the nerves calm has helped a lot. I hope you are doing well. Thank you for your reply. You're very welcome, hon. All right, guys. I know it's a little scattered today, but obviously I'm in, on a scale of 1 to 10, my pain today, if I move the wrong way, is a 7. So thankfully, it's only when I move. I don't have pain sitting, but doing anything else, it kind of hurts. So I will see you guys later. Wish me luck. Okay, we're going to say goodbye to YouTube. See you guys later. Make sure you come on over to the IC Network website, sign up for a free newsletter. All right, YouTube is gone.